I've done that.
Okay.
I have it on now, although I could turn it off until, let me turn it off until.
Hi, good afternoon.
Hi.
Hi, Jenny.
Hi, finally here.
Long time
Oh,
no
there's
see.
yes, Jenny.
How
Let
are
me-
you?
Good, thank you. And you?
Hi, Jenny.
Hi, long time to
Oh,
see
Jenny,
you.
welcome back.
Thank you. Hi, Edwin.
So, let's see, we have, of course, me and Edwin. I'm just going from the top. Jenny makes 3, Monique 4, Heather 5. So we have a quorum. If we, Edwin, are you ready to start?
I am.
Okay, so it is now 6:35 and the Committee for Health and Environmental Community Board 9 has started. Welcome everyone. As you know, this is the last committee meeting of the fiscal year. And I know Edwin and I were talking about some issues that are pressing, and we will see if committee members, would be agreeable to a July special meeting dealing with violence as a health issue. So, when it comes time for that, Edward, did you want to, there was an interesting conversation we had yesterday.
Quickly before we get there, did we call the meeting to order?
Yes,
Okay.
6:35.
Okay, so 18:35. Okie dokie. So yes, so Laquita and I, we were talking about yesterday in regards to looking at gun violence. And some of you might be aware that gun violence is not only looked through the lens of law enforcement, but also through the lens of public health. And it is looked at as a disease within a community. So when you look at it through that lens, you're looking at it more holistically as to how you can prevent the violence from happening. When we do that, we have to, as a community, look at the various factors that are creating stress in our community and increasing the risk of gun violence. With that being said, I think that the Health and Environmental Committee plays a role in helping our community identify such. And for that, we're going to need various partners. One of them is the NYPD, right? But you have other parties that play a role into the health of the community. And when you look at nationally, some of the public health efforts that are taking, precedent, it is to look at violence as a disease so we can try to help our community. So that is something we want to have an exclusive meeting in July where we can bring the various players in our community, whether that be the Department of Health. I think, we have WEAC here that also plays a role because how people live impacts them. And environmental.
Chief. Mm-hmm.
And environmental. Yeah. Go ahead, Lupita.
No, I was just going to add the police chief we talked about.
Indeed, to have the NYPD not only to provide us the stats about the crimes and yada, which is important, but we want to understand what is being done so we can prevent it from happening prior to such. We saw that the mayor this past week created a chief officer to try to help decrease the gun violence. But we have to get a hold of this in our own community. And we welcome anybody's feedback when it comes to this.
And so we'll bring that up at the end, but it gives you something to think about during the course of this meeting. And there you have it from, you guys may have heard it here first, Dr. Edwin Torres. He received his PhD from Columbia University. This
Oh,
has-
Binghamton University, I'm sorry.
okay,
Yeah,
okay. Well,
a lot
but I
less
know you've been
loans.
up at Columbia.
You're right.
Well, you give us that part of it, but it was in May, and so we salute you, Edwin, because it was a lot of hard work and
Congrats.
diligence.
Yeah, I
Congrats,
see.
Edwin.
Yeah, I see the PhD there, so it looks like it's official.
Yes, yes, thank you all.
But correct me, where is it? It's from which university? I just want to be corrected.
It's a SUNY school, Binghamton University.
Good school.
Okay, there you have it. And he's now at Columbia Presbyterian working.
Oh, Montefiore, sorry.
Oh, Edwin.
No, I know, Laquita, you know, Columbia, you know, is right next to us. But I do work in Washington Heights at different clinics. So yeah, we'll talk about dissertation and everything later. Yeah.
Okay.
And Edwin, may I add that again, congratulations, but I think we should invite like a youth groups as well, like Brotherhood Sister Soul, who works specifically on youth, to that
Absolutely.
summit.
Yes.
That they could come and give that lens, because there's different components, and I'm just gonna shut up after this. Different components with this gun violence. You have an older crew, you have the public housing crew, and then you have that young contingent that's just doing whatever they want to do and they don't care. So I just think Brotherhood Sister Soul can give us that young community lens at that meeting.
That's a
You
great
you need to
suggestion.
you need to contact some of the violence interrupters, because
Right.
the police have taken a stance that they're going to arrest their way out of this. It's not happening. So, you know, we have to deal with, they have their policy, and their policy is to arrest. That's it. Ain't no crime prevention. It's just arrest. So, you know, we have to deal with that. We have to deal with the violence interrupters who are really on the ground trying to prevent a lot of this that's going on. But, you
That
know,
would
here's
be
the
like We All Really Matter, like Stephanie McGraw's group that led the
Yeah,
gun the rally. Would it be an organization like We All Really Matter?
Yeah, but they're not really doing gun intervention either. What's the sister's name that has the storefront on 145th Street?
Seda Saku.
Yes.
That's right. Yeah.
She's doing a,
Yes.
she's doing a
can-
lot of work.
Yeah.
She's doing a lot of work on that. And to be honest with you, I don't know who's working in the projects up here. I mean, our
have-
stats.
Victor
have-
knows, right?
Let me just interrupt. Yes, we do have Tashana Chicken Murphy Foundation working
Right.
in Manhattan.
Right.
Say
and-
it again, Victor.
Tashana Chicken Murphy Foundation. That's a young sister that was shot and killed
Right.
about 2011. Her father started this foundation, and he has
Yes.
violence interrupters. They work out of our office. You know, they work right out
Oh,
of
okay.
there, and they are right there. But we can have them come. I just wanted to say also that my meeting on the 21st, I've invited NYPD, Boys and Girls Club, West Harlem Development Corp, the 30th and the 26th to speak specifically what their plans are for the summer concerning our youth. I'm very
Right.
That's
concerned what
strategic
program-
planning, Victor?
Correct.
Yes. Okay, so we'll get the
21st.
notice out to those who are part of this committee.
Thank you, Victor. I would attend that meeting. And thank
Okay.
you, Monica, for your comment.
Yeah,
Because,
they,
what happens is that, you know, everyone looks at the world through their lens.
Right.
And the PD, they tend to, you know, see things as an enforcement, yes or no, type of thing. And, you know, they can learn from listening to others, listening to folks who devote their lives on this. I share what the American Public Health Association has. They have very good information as to looking at gun violence. And these are not, you know, folks, you know, these are people who study this disease in communities. So enforcement plays a role, but indeed, like you said, it's not the only tool that we can use to decrease the violence.
All
But-
very
and just
excellent
so-
ideas.
Just so everyone knows, you can follow the crime stats for every single precinct in New York City, and our crime stats are nowhere near close to like half the murders in New York City happen in the Bronx.
Yes.
More than half the shootings. So and we're nowhere even close. So we're not in bad shape.
That's a good thing.
Yeah.
That's,
No,
yeah.
it's a good thing.
Mhm.
Yes.
I'm
So
sorry.
it sounds like we're gonna get a yes.
Laquita,
for when we come
question.
to that. Uh-huh.
I'm sorry, just where was the other organization? 145th and where?
Yasha Sekou, I thought she was 135th, but she could very well be 145th, but she's Aisha Shaku, and I forget the name of her organization.
Yeah.
I'm on Facebook. Maybe before we, by the time we come to the end of the evening, I'll look it up and just give it to you. But that was a great idea from Monica. Yeah, Aisha Sekou, Sekou. And I may be wrong. I may be wrong, but I thought she was 135th.
No,
and,
she's on
7th.
145th. She's on
Okay.
145th between Lennox and Adam Clayton Powell. But
And that could be her new office. Yeah.
yeah,
Yeah,
the
she's got new-
other issue is there are no plans for these kids to song.
Mm-hmm.
Right.
That's a,
I mean,
Caring.
we have to be honest about it.
You're right.
There's no day camps, there's no nothing, and it's just gonna be mass chaos. They're talking about they're gonna have problems with the pools because they don't have enough lifeguards.
Oh, wow.
So I don't know what the youth committee is doing, but we need to get the resources. I don't know if we can mobilize the West Harlem Development
Oh,
to
I think
donate.
West Harlem Development was going to come up with something by the end. It was late and people were complaining about it at the last meeting, but supposedly by the end of June. Is that correct, Victor?
Oh
Do you
my
remember that?
God.
That's too
They
late.
said it was late, and we remember at the board meeting, we talked to, some people brought it up, that it was very late,
Well,
and
let me
Victor
just
brought it up.
interject for a second on that. What I said at the board meeting was West Harlem Development Corp was going to write some checks to some agencies and kind of say this is what they're doing. Now, that's what they did. They wrote checks to the Boys and Girls Club so that young people could participate and not have to pay. They wrote checks to the Harlem Jazz Museum. So I think it's 20 young people could participate in that program, and they get a stipend at the end of the program, I think of $250. But that's a far cry from what the Arise program was doing, 100 to 150 young people, and the young people that we want to reach. These are the young people that look forward to this every year, that came from the community centers, that came from Manhattanville and Grant, and we're trying to do the right thing. So I've invited the Judge Tingling, the chair of West Harlem Development Corp, along with Ziad, the new executive director, to my meeting to explain what they intend to do for these young people since they have snatched these employment opportunities from them. So I'm waiting to 21st.
Wow.
But it's
So
far
I'll
too.
make sure that our health, those that we send information to outside of our immediate committee gets that information too, if you don't
Great.
mind, Victor.
Sure, thank you.
Mhm. Okay.
Okay.
So we'll come back, but it sounds like that's going to be a yes, and I appreciate this discussion. I'm sure Edwin does too, and I think it was a great idea on Edwin's part because things are so heated right now in the country as it relates to that, and all of us are concerned. So let me go back. Now we move forward with our regular agenda. Can I get a motion for approval of the agenda? And hopefully most people got to see that. It was
Before we go forward, I'd like to
sent.
say one thing, if I may. My name
Yes,
is
Patricia.
Hi, Patricia.
I'm sorry, I came in a little late. Systems are acting. I'm a minister. I'm an associate minister at Convent Avenue Baptist Church. If there's any
Okay,
information
welcome.
you have, thank you. And I was just informed I'm a member of the board. How about that?
Oh, congratulations.
Oh, wow.
Well, you were probably introduced last, oh no, they said there were additional members that we would learn about
I
later.
just found out a couple of days ago.
Yes, welcome. We, are excited to have you with us.
I'm very happy.
Which
Okay.
church, Miss Catwell, you say you were with?
Caldwell, yes.
Caldwell.
Minister Caldwell, but
With Convent?
Convent Avenue Baptist Church, where the pastor is the Reverend Dr. Jesse Williams.
Yes.
We're located on the corner of Convent Avenue and 145th Street. That's where our property is also located. We have property on 145th. We probably basically that square block, across the street, a few brownstones, et cetera, et cetera. But what I'd like to get some information on is for the WE Act and what you intend to, what's going on.
Well, we'll get to WE Act
that.
because they have a presentation. So you're a little ahead of us, Reverend Caldwell.
I'm so sorry. I'm so sorry. I just wanted to hear because I could get back to you on something that maybe we can assist.
Yeah, you'll hear. Edwin, can you share the agenda? Thanks, Jenny.
Absolutely, I have it right here.
Okay, that will be good because it wasn't really finalized.
I am writing as we speak.
Okay.
It's
Okay.
small.
So there we.
It is small?
If you
Can
pinch
you put it
it,
again?
I think if you pinch it, it will zoom for you. Was that Heather? Just pinch the screen.
Is that the agenda?
Yeah.
Uh-huh.
Oh, I printed it out. I'm good.
Okay. So I don't, is there anything someone would like to add as they look at the agenda as it's presented now?
Okay, shall we move forward?
If not, can we get a motion to accept the agenda as presented?
So move.
Second.
Second.
Okay.
I think that was that Monica who moved?
Yes.
Or was that Monique? It was
That was Monica.
It was Monica.
Yes.
The other
And-
Monique.
And second was Monique. Okay. And you guys may have heard the story of the minutes. We will have a cluster of minutes, July. The issue is that we have recordings, but we were not able to pull them out in transcript format as we were initially back in January and February. There was some little snafu. So we'll get that together. And I just didn't have time to do it the last several weeks. But we will have them.
I'm writing the minutes,
Edwin?
so to speak, yeah. So I am writing the minutes, yeah.
Okay. Okay, thank you, Edwin, for writing the minutes for us.
Okay, Jeff Bailey.
And so now, let's see, then I'll be trying
Let's
to.
put you as a co-host. Okay, let me.
And, while, before moving to Lewis, Charles Shorter indicated that Aisha's group, and I'd forgotten this, name of it is Street Corner Resources.
Yes.
And I know she's gotten a couple of significant grants within this last year. So that's such a terrific idea.
You're gonna have to make Bailey a co-host so he can share.
I will.
Yeah, thank you.
Thank you.
I will.
Great.
Okay, let me do. So now we're ready for presentations. Let me get to Bailey. Make whole. Oops, whoops. Hold on. Bailey, make co-host. Do you want to? Yes. Okay, so you have access now, Bailey?
Yes, I do.
Bailey was invited to present, because we've done, we always do a lot in terms of health, our physical health. And though WEAC comes and we hear, we get information on the environment, there's so much more that we don't get to cover. And so I wanted to make sure with WEAC doing so many important things in the community related to various seminars, making us ready for climate change, and involved with so much in terms of policy activities. There's a lot to learn and to know. So I invited him. And right before he speaks, I just want to point out that in today's AM New York, a bill allowing New Yorkers to sue for loud helicopter noise passed. And the reason I brought that up is because one of our committee members who passed a few years ago, Catherine Abadi, this was her strong issue. There was almost never a meeting that we had where she did not bring up the loud helicopter noise. And so as the newspaper cited, it would allow New Yorkers to sue companies for excessive helicopter noise. And this was passed out of both houses of the state legislature. And it says the legislature would also lighten regulations for choppers using a heliport in Manhattan's West Side, but it comes up through the Harlem community. And so it creates, there's so many of them, and it created a real, a lot of complaints, over 25,000 complaints. That's a major increase, 150% increase since just in 2021. So I wish there was a way we could posthumously, say more in terms of Catherine, because I think she also helped bring that attention to the legislative bodies.
And I would like to say, to that, that shows the importance of continuing to call 311 with issues that you have, because those numbers, they matter.
Yes.
It might seem like, when you call maybe the 80th time, you're like, this is, an issue that is not going to get resolved. But number speaks volume. So if you have a problem that is not fixed, continue to call until it is resolved, because the helicopter issue was a noise situation and a pollution, and now we have legislation.
Exactly. It may take a while, but stick-to-itiveness is what counts, and getting it recognized with our numbers at the complaints at 311, because it went from, let's see, the paper said here, 10,359 calls in 2020 to 25,821 calls in 2021, just that year. That is a huge increase. Bailey from WEAC, are you ready?
I am ready.
Okay, you have it. Take it away.
Can everyone see the screen? I just want to make sure everybody sees it before I start.
Yes, we can.
Okay, good evening, everyone. My name is Bailey. I am WEAC's manager of membership and organizing for WEAC. I've been their manager for 2, but I've been with WEAC since 2011. I had this slide put in here. It pertains to something that we're going to be talking about later. So I just want everybody to put in the chat, if you can, what are you going to do to beat the heat this summer? That was my question, and I'll piggyback on that a little later on in my slides. So for those that don't know WEAC, our mission since 1988 has been to build healthy communities by ensuring that people of color and low income participate meaningfully in the creation of sound and fair environmental health and protection policies and practices. That means we put the community in the forefront as we build on city, state, and federal policy. We act as a New York City office on 152nd in Amsterdam in the old 30th precinct, and we also have a DC office that works on federal policy. I'm going to skip the membership slide. So the agenda today, let me move this out the way. I'm just going to talk about some of the initiatives that we have for this summer. And if there are any questions, comments, and concerns, please raise them so I can bring it back to the leadership so we can make sure we're providing the most adequate information for not only CB9, we do serve Northern Manhattan, so for community boards 9 through 12. The first thing I want to talk about is our Beauty Inside Out working group. This is a working group that works to make sure that women, especially women of color, understand the care products and the beauty products that they are using. You know, there are some toxins in there. You know, there's mercury, and we're talking about makeups and lipsticks and lotions and all of that. So this Beauty Inside Out working group meets bi-monthly. So the next meeting is going to be June 8th, and they talk about all products, especially when it's targeted, because low-income communities and communities of color spend more money than any other ethnic group on beauty products. And like I said, lipsticks, hair care products, nails, nail salon, glues, all of that. We spend more. So just wanted to give you that if anybody is interested. Her name is Sophia at weact.org. She can invite you to the meeting if you're interested. The second thing I want to talk about is cumulative impacts. Communities deserve a healthy environment. So we just recently passed the cumulative impacts bill in the New York State legislature. This piece of legislation will prevent companies from putting polluting facilities in our community. As you know, Northern Manhattan, we have 5 bus depots. Well, now we're down to 3. We have the sewage treatment plant. We don't need any more toxic polluters in our community. So this cumulative impact would force companies to prove that they won't be adding to the burden that is already faced in New York City. And if there's any Bronxites on the call, this covers you as well. So this is important legislation. The virtual meeting is coming up on the 8th, which is Wednesday at 11 a.m. to 12. We're going to celebrate and we're going to discuss how we're going to make sure not just passing this legislation, but how we're going to make sure it's enforced throughout the community. We also have a lead advocacy workshop, which is going to be June 16th. This is for not only just children, but this is also for adults. What are the causes? As we know, don't let anybody tell you there is no safe form of lead. You know, parts per billion, there should be 0 parts per billion. There should be no lead in any of our drinking water. We're going to be talking about the lead laws and also the We Act Lead bill we're trying to pass to make sure we strengthen it even further to protect our children. So that's June 16th, 6:30 to 7:30. All this information, I will forward it to you, Laquita, or anybody else who wishes to have this information.
Okay.
We're having a team up to clean up event. We're working with West Harlem Development Court, Community Board 9, headed by Signe. So what we're doing is we are going to have a cleanup day on Saturday, June 25th. It will start at the We Act office, go down Amsterdam, touch the Broadway Mall. It'll touch Manhattanville. We're going to swing past Grant. It'll terminate at 142nd and 7th Avenue. So we're going to bring awareness that, as we know, Northern Manhattan, they do not do the garbage cleanup more efficiently as our below 96th Street counterparts. So we're bringing the community together to pitch in, to show them, hey, we care about our community, but we want to force sanitation to make sure that they give us the resources that other parts of the city get, that Northern Manhattan is currently not getting. So that's June 25th at 10 a.m. If you're interested in participating, I could send you the link. As you can see, we have 150th Block Association, Community Board 9, Brotherhood Sister Soul, Monkey Cub, Manhattanville Houses, Fred Samuels, and our elected officials. So Manhattan Borough President, Assemblyman Al Taylor, Cordell Clear, and Congressman Espaillat will all be joining us on June 25th.
Did you send this also, Bailey, to the Uniform Services
I
Committee?
did not. I sent that to Youtha, and I thought Youtha was going to send it
Oh,
out to
okay.
everybody.
I'm
So,
sure she
but
will.
if I will, I mean, if I need to, I will send it out.
Oh,
So,
she's pretty good. She'll send it to everybody.
okay.
Yeah, once you got it to youth, I just wasn't sure.
So this is very big. I'm talking about WEAC's extreme heat advocacy. We've been working on some of this stuff for the past like 7 years. As you know, the heat wave we just had, when degrees get above 90, it's really, really tough, especially for our seniors. So WEAC is starting this heat health and equity initiative, making sure that as you see on this slide here, that we've created a cooling center finder. A lot of times those cooling centers are either moved or they're just not there anymore, or the hours have changed. So we want to make sure that our seniors and the entire Northern Manhattan is taken care of. You can also sign up for Notify NYC. So making sure that you'll know in advance there's going to be a current heat wave. Making sure members know about applying for HEAT, which is the Home Energy Assistant Program, and also signing up for our newsletter. And I'm going to talk more about HEAT in this next slide. We are doing what we call a heat exposure study, which will be done beginning sometime in July. I did send this also out to Youtha. What we're trying to do is understand the dual threat of heat. When you're walking out in the community, we want to understand what's on your person as an individual. And I'm just going to use you, Laquita. In this study, we would give you a monitor to walk around with for a couple of days, and it would send us data. But then we would put one in your home to understand the heat if you do not have air conditioning in your household as well. So we're going to compare those numbers and build some legislation around making sure that the legislators and the state knows that, hey, we have to protect ourselves from heat exposure. So that would be the study. You would wear a sensor again around your person for about a week, but it'd also be tied to a sensor in your home. And it would monitor the heat inside your home as well. If you don't know, the heat inside your apartment is 10 degrees higher than it is outside if you don't have air conditioning. And a lot of our members in the community do not or cannot afford to run their air conditioners during the summer. So that is our heat exposure study for Northern Manhattan. And we would invite community members from not only Community Board 9, but 9 through 12 to help us build some power and pass some great legislation to protect ourselves.
I have a quick question in regards to the study.
Yes.
Has this study been approved by IRB?
Yes, it has.
Which IRB?
That I don't know because I'm not doing it, but it has been approved. All our studies, we make sure it's approved by IRB before we begin implementation.
And for those who don't know,
can you say what IRB is?
I was going to say, go ahead, Dr. Torres, go ahead.
It is an institutional review board that comes from universities or hospitals. And the reason why studies, they have to go through this board is because we want to make sure we don't have unethical studies being done in communities that can adversely affect them. Sometimes, to the researcher themselves, they might not, we all have blind spot. We remember, the extreme, what happened in Tuskegee, in which a population was kept away from having, penicillin, and they were left to, to have syphilis. So what you want is when the study is published that these findings don't have an adverse, or unintended consequence to the group that is being studied. So that's why they make sure that, these studies are ethical, basically.
And it also includes people who are doing the study, Laquita and everybody else. Yes.
Okay.
Yeah, and make sure that there's a protection. So I'm just going to use myself. I can't be leading the study knowing that I work for WEACT and or, you know, like you can't have that bias, as Dr. Torres says, like a blind spot where
Yeah.
I have undue influence on the study and on the results, because I can make the results say what I want it to say. So the IRB protects, they have a criteria that protects the community and the participants from that, even their information as well.
And to be fair, also communities, they have IRBs to make sure that whenever studies are done in their population, that these are done ethically.
So if anyone is interested and they think they might be interested, you can reach out to Sonal. I can send this information again, everybody, Sonal@WeAct, or they can reach out to me and I can get you the information.
Okay. Is there a minimum number that will make for
Sorry,
a
let me
good
just sorry, I
size
pushed.
study?
We're looking at probably 5 to 7, maybe 10 per community board, because we remember East Harlem is different from Central, which is different from Washington Heights, and you know, and so we want to make sure it's fair and not, you know, say it all came from CB9 and be like, okay, wait a minute, you know, Community Board 11 East Harlem might have a different outcome and everything. So depending on like 5 to 7, but no more than 10 per community board.
Okay.
And if the study can handle more, I'm sure they will take more. They're not going to tell nobody, no, you can't participate. The more is better. But we just want to make sure that we're getting the right and accurate data, so we can come back and present the same data to you and say, hey, this is what we found when we did it.
Okay.
We are working on we had an idling trucks workshop about a week and a half ago. This is a program where community residents can participate in reporting community idling wherever it is in Northern Manhattan and around the city. So the New York City DOP is going to reach out to community boards this fall and try to form a working group around that. And I put the Charles ST@DEP NYC if anyone is interested. But we're very interested in the idling trucks around the city. You know, if you lived in the Bronx, you know it's right by Yankee Stadium. If you're down on 34th Street, it's right by Penn Station. It's all over communities all over the city. So we want to make sure that the lighting law is adhered to. It's only 3 minutes. And if you go beyond that, there's an app that you can participate in and report it and get paid for it too. So so if you're interested, anybody's interested, you can reach out.
Question.
Yes.
How do food trucks, they use generators that have gasoline. How does that work as far as pollution?
I think food trucks, as far as I know, food trucks are exempt, and so is New York City buses. They are exempt. We're talking about delivery trucks that are delivering food and other type of perishables throughout the community. But I think food trucks are exempt.
Thank you.
Monica, you had a question?
And yeah, if I can't see who has a question. So
I'm sorry,
yeah,
not
yeah.
Monique.
Monique.
I thought I heard Monique.
Monique, do you have a question?
Okay.
No, I don't have a question. I'm sorry.
Okay. All right. I just wanted to make sure.
Thank you.
And our last thing is we're going to be doing summer movies in the park, as we've done for the past 9 years. We usually pick an environmental justice movie. This year, we're going to split them up. We're going to have one at West Harlem Pierce Park, and we're thinking about doing the second one at St. Nicholas Park. We're trying to branch out the summer movies. And like I said, we've been doing it for the past 8 years. And we're going to be participating in Harlem Week. The dates I don't have just yet, but those are the other 2 things that WEAC is going to be doing as we head into the summer. That is it for me. I'm willing to open it up. I don't know how we're going to do this, Laquita, but you let me know if people have questions, comments, concerns.
Thank you for the report.
Well, let's
Laquita.
see. Are there any questions or statements based on Lewis' report, on Bailey's report on all the work that WEAC is doing?
And I must say also, thank you for Community Board 9. Y'all have been great.
Yes. I was
Yeah.
gonna say very thorough.
Jenny,
Thank you.
oh, Monique, and then Jenny.
Yeah. Go ahead, Jenny.
Oh, I'm sorry. I was taking a call. Okay, thanks for everything you bring today to our meeting. Then I have a question. I don't know if you have the answer, but some neighbors and some friends are asking me about if some city help for to get the AC, the air condition. Do you know where they can get any AC to low income?
As far as I know, the money for that was not reinstated. We haven't heard back from them, but that doesn't mean it's not going to come. But as far as I know, the money that was for that program has not been reinstated. It ended basically at the end of last year. But I could find out, Jenny, if you send me your email, and I will follow up with you and get you the information, the most current information.
Okay, perfect. Thank you so much.
And I see something about the my school bus engine. Oh, it goes off after 3 minutes. Okay, great. Because also I did mention it in here because there's really no updates. We passed legislation at the end of last year that the New York City school bus system, that fleet will be electric by 2035. There's going to be a slow outroll over the next couple of years, maybe like 25 buses, then 30 buses. But by 2035, the New York City school bus fleet will be automatically electric.
Wow.
Oh,
But
wow.
the first small group will be in 2 years, 2025.
Like 2025, they're supposed to roll out, because remember, there's different companies. So each individual company will be given some time to like slowly roll it out. Because remember, you have to do the infrastructure. If your building that holds the buses is not, doesn't have the capability, then it won't be, so.
Right. Excellent. I know you reported on that before, but it still sounds great to hear.
Yeah, we're really proud of that because it protects our kids. We're really proud of that.
Yes.
Monique?
No, I was just saying thank you. Your report, Bailey, was so thorough and very encouraging. So
yeah,
that was it.
I was going to comment on the products, the beauty products that are targeted to communities of color.
Yes.
We, for the first time, we're going to celebrate Juneteenth, and a lot of the big companies now they are, coming up with everything about Juneteenth so they can get more commerce. So thank you for taking that effort and educating our community on some of the toxins that these marketing are trying to cover up.
Yeah, there's a lot of stuff, and just I don't want to monetize the meeting, of course, but fragrance is another key indicator that it's not healthy for community. So all the perfumes, the fragrance that's in that is toxic, and they don't want to let you know. They don't want to let you know that, but it is. It's toxic.
And they and Bailey, to that, they get this fruity smell that people like. But when I was in chemistry, we used to make this, smell in the lab, and we had to wear goggles and we had to wear a mask, a P100. So yes, our community needs to be aware of these tactics and some of these smells and colors that are targeted to us.
I put a link in the chat for everybody. This is an app that you can download on your phone, and if you put it'll scan the barcode, and it will show you if there's any toxic chemicals in that product. So if it's like, again, lotions, eyeshadow, lipstick, nail polish, all of that. I have another one. I'm looking for the other one. There's two of them. There's Redify and there's another one. So please, download the app, ladies, gentlemen too. It's not just women, it's men too. We use, deodorants and all of it.
Right.
You already know that Johnson & Johnson has been taken off the market with their talc. There's so much stuff out there.
That's right.
We gotta protect ourselves.
You're right.
How does WEAC get all of this information out beyond your committee? I know advertising costs a lot, and how do you're talking to community boards? That's one broad way. But what other ways do you have? Because it's such important information, the heat, health, and all of that.
Well, it
Is it?
starts with, if anybody knows Charles Calloway and myself, the organizing, basically brings the issue up. Then we have a policy team that works with legislators on the city, state, and federal level to say, hey, this is an issue. Now, we also have what we call the EJ Forum, which is 54 groups in 28 states that are working on similar legislation and policies, but they don't have 25 people like WEAC has on staff. So we help them to get the information out on a broader scale on a federal level. So it's like learning the crawl before you walk. So we get it on the city level, get that information out, state level, working with, of course, Governor Hochul and all of that. But on the federal level, we have a DC team that works strategically on federal policy stuff. And that's how we get the information outside the community. Like cumulative impacts is not just Northern Manhattan. Dr. Nikki Sheets passed it 2 years ago in New Jersey, and there's only like 5 states that have passed cumulative impacts. So we're trying to get it across the board.
Thank you.
And what's the? Yeah.
Yeah.
What? How many working groups are there with WEACT?
There are 5.
Barely.
There's 5. There's Beauty Inside Out. There's voter engagement. There's climate justice. There's healthy homes. And then we have what we call the planning committee, but we're more of you have to vote to be in the planning committee at WEAC. And then we have a workforce development. So Victor knows about it. We train no matter what your age, 18 up, in getting your solar panel and your OSHA certificates. And we do that for free in conjunction, of course, with WHDC. They've been providing us the funding for that. So anybody that's interested in that, I'll put that in the chat as well, because we want to make sure that our community, when it comes to construction, gets those jobs, when in the past we couldn't get them because we didn't have the certification.
Wow. Okay, so there are 5 working groups.
Yeah, there's 5 working groups.
Okay. If any committee members or anyone in our meeting this evening is interested in being a part of the working groups, Bailey has put his information. There may be other conversations that have gone past, but he has his information in the chat there.
Yeah, I'll put it in the
At least
chat.
I thought I saw it. Can you put it in the chat again? You put Redify in there. That's what you did.
Yeah.
But put your information too, just for direct contact. Let's see if there are any other hands that are
I have
up.
another question. Was in regards to lead.
Yes.
The response from the Department of Health when folks call 311, it is very slow. I have had in my own building with the tenants issues with lead, and the effort that it has taken to get them out. I just think, what happened to those who don't have a platform like we do? Because to a certain extent in our community, we have some privilege because we know who to contact and, if not, who to send an email to. But I'm thinking of the folks in the community who have to reach out just to 311 and then have to wait days to get to hear back from the Department of Health. Is there any effort to try to push them so they can be a little faster when it comes to lead?
We have tried to open that dialogue, Dr. Torres. It's been hard because we hear a lot that they're understaffed. It'll be forwarded to another person. We haven't really found what is the actual steps. Like when I call 311, where does that call get, how does it logged in? What is the necessary response time? If you call today, you should hear an answer back by how many days? And if not, where does it get kicked to? We haven't been able to find out what it is. It's trying to get through that bureaucracy, if you want to use that word. But we're trying to make sure that they know that they're doing a poor job in terms of response time with
Indeed.
just anybody, because it shouldn't be because I work for We Act that I get in and somebody from 3333 doesn't get in. It shouldn't be that way. 311 is for everybody.
Yep.
Right.
So, any effort that we can help as a community board to push that through, please keep us posted, because
Okay.
lead is an issue in our community. And the folks who make a call to 311 should have a quick response, and not like you said, because we have some insight into the system that others are left out.
Right, because someone who calls on the phone is not going to say, well, or ask the pertinent questions that I'm sure people on this community board will ask. Okay, when should I receive a response? If I don't get a response, who do I call? See, probably most community members are not going to do it. They're going to get frustrated, and then they come to the community board, and of course, We Act and other people to say, hey, I called twice and I didn't get any help. So I understand that, and yes, we're going to work on that further, because, and the other thing tied to the lead is lead in water. 2 years ago, up in the school, there was 2 schools in Washington Heights that had lead in the water. They had to close the water down, and they had the meeting, but they didn't have the meeting when they told the community. They didn't even put the information out in other languages other than English. And this is Washington Heights, so you got to put it out at least in Spanish.
That's right.
But they didn't even do that. So we told them, okay, if you're going to have a meeting, all your thing has to be in multiple languages, because of course we're a multi-language city, no matter where you are. So we let them know that, okay, in no uncertain terms, and you have to do it in advance. You can't tell me about a meeting tomorrow, tonight. You have to give people advance and notice, and they should know that, but we keep pushing them to say, you got to do better.
Absolutely. And to that point, also landlords, as soon as you put a 311 complaint, they get a message quickly. So whatever lead exposure they have, basically the city is given an ample amount of time to just, clear it up. And by that time, you have residents who have been exposed.
Yes. And we definitely don't want anybody, especially, with the health risks of developmental delays for our children, I'm not just making adults, but our children are most vulnerable. Once you got lead in your system, you got it. There's no way getting it out. You can't flush it. So we're going to work to do better and make sure, but thank you for bringing that to our attention. I was looking for that other app.
Thank you so much, Bailey. As We Act is an amazing organization doing incredible work. And there's so much, you're bringing so much to our attention that we need to be aware of and try to, it's hard to be on top of everything, but we need to at least be aware and know what we can do or how we can combat a problem.
And I just want to close with this last statement. We're 25 people in our New York office. We have 7 in DC. It's really hard. There is so much going on health-wise in the community and around the world, being strategic to make sure that we're hitting all the targets. It is so hard. When we sit in our meetings, like tomorrow morning, we'll sit down and discuss, what are we going to be working on? Because let's say, and Miriam, I see you on the call. Miriam has an issue, and we're trying to get her some help around her building and this pollution that's coming around. It's just so much going on, and it's no excuse, but we're really trying to make sure that we're hitting all the targets, and sometimes we miss.
But you're trying, and we have to be out there trying.
Yeah, yes. So I just want to let everybody know that if we could do all the 19 things that we wanted to do, we would do them all. So. Oh, and last thing, sorry, I keep saying the last thing. 125th Street elevator lobby. We're up to like 215 petitions signed. So we've heard from our elected official, Shauna Brew, that they are going to move forward in trying to put an elevator at 125th Street and Broadway. And if you don't know, the escalator only takes you to the mezzanine. It doesn't take you to the platform. So we're advocating to make sure that our seniors or people with disabilities are able to just get up to the platform without having to take extra stairs.
Wow.
Wow.
So that is a big win because, you know, they fought tooth and nail to try to like, no, they can't be done. If we can transplant a heart, everybody, we can build a doggone elevator at that station. No matter how intricate it may be, it can get done.
Absolutely.
I have a
And-
question.
Yes.
In terms of elevators, it's probably too late to ask about anything being done at the station here, 145th Street. We have an
One-
escalator on one side and nothing on the other side, which never made sense to me.
Yeah, as far as I know, the 2024 plan, the only elevators that are coming to it, I'm using Northern Manhattan, 148th Street and Lenox, they're going to get an elevator, and I think one is going to go to 137th. But as far as 145th is not in this capital plan. It's
137th and Broadway?
Broadway. Yes,
or-
they're supposed to get an elevator there.
Wow. And
Well,
our station is so big, which
I
doesn't
know.
make sense. That's a major station and it should have an elevator.
I understand that. When I first got hired at WEAC, I was the transit organizer, and there's so many different stations around the city. And I'll give you a quick example: 149th Street, Grand Concourse. If you go from the 2 to the mezzanine to the 4 level to the mezzanine to the street, that's 180 steps without an elevator. Now they're going to put one there, but I fought for that. I was a Bronxite once. I fought. That is that many steps to get all the way up.
Yeah, that's a
So-
big station
Wow.
too. Yeah.
That's a
Yeah,
big
it
station
is.
there.
Yes.
That is a big station there. So it's 17 to get to the mezzanine, 17 more to get to the 4 level, 26 to get from the 4 level, the 4 train to the next mezzanine, and then 22 additional steps to get up to where you're at Hostos. That's a lot of steps without an elevator. So it took them almost 25 years to put an elevator in, but they are getting one. So we just got to continue to advocate
It
and fight.
requires petitioning.
Yes.
Yeah, petitioning and fighting. I want to welcome Tiffany Khan. I believe Tiffany, I'm not sure if you've come to one of our meetings, but your colleague has presented to us well, and I've enjoyed hearing you when I attended the WEAC meetings as well. So welcome, Tiffany. I'm not sure if there's anything you want to add or not in terms of your work group. Did she? Oh, wait a minute, maybe she's not on now, but she was.
So Bailey, I
was.
also added some literature dating back to 1988, in which it is very well established that lead causes harm to people's health,
Yes.
especially blood pressure. In our
Yes.
community, when you look at, folks of color, the number one reason why we die, it is cardiovascular disease, meaning heart attack, stroke, or sudden death. So don't let anyone tell you that lead is only harmful to kids, because that is not true.
Mhm.
Reverend Caldwell, was there something, you mentioned something early on. I hope that you wanted to say or question you had for WEAC.
I just, in the chat, I forwarded that they send me their information and what, I don't suppose that Act had anything to do with plans for our youth for the summer. They're more of a watchdog organization, is that correct?
Yes, we do not have a youth component in our organization. We do not. We just don't have the capacity. We would need a separate, at least 3 people to focus on youth, because that requires a different targeted outreach that we just don't have the capacity.
With what you presented, I found it to be wonderful, and I'd like to get some more information from you on what in fact you do have, so that I'd like to be able to maybe even attend your meetings, or at least, Zoom.
Okay, yes. So we have one. I'm not going to pitch that, but June 11th, we have one the second Saturday of every month. If you put your name in the chat, I can send you the link. I mean, your email, I'll send you the link.
And as soon as you can send the presentation to me, Bailey, and I'll get it out
Will
tomorrow.
do.
If you send it,
I can send it right after this
tonight
meeting.
or
And yeah,
tomorrow.
tonight. And Jenny, I will follow up with
Okay.
you as well. I'll have an answer for you by tomorrow.
So did we answer all questions? I'm not sure. Heather, did you have, wait, a minute, I did see something. I'm not sure if Heather, 4 trains meet at 145th and St. Nicholas and no elevator or escalator on the other side. Right. That's what
Mhm.
was stated. Yes. She's
Yeah, that is,
supporting that idea of the need for an elevator.
yeah.
Yes. You were wonderful, Bailey. We're going to invite you back. Be prepared, as you always are, to come back again, and keep us posted. And just a reminder: anyone who wants to be part of the working groups, reach out to Bailey as well, because I'm sure they would welcome the ideas. A number of us sat in on the heat. There was a heat study. And I'm not
Yes.
sure if we have the results back from that, but what if there was some emergency? And so when do you think that study will be revealed?
I can't, I don't know. I'm just going to say I don't know. I don't think it's
Yeah,
going to
that's
take past the summer. I think they'll have the data back probably like August, maybe no later than September. I don't think it's going to
right.
go past
I know
that.
Victor participated, I participated, and there were a couple of other Community Board 9 people who did as well. It was wonderful. Okay, thank you.
And thank you.
So we'll
Thank you.
move on to the next thing. If I believe it's the task force of the cannabis task force. Is that correct,
Yeah, that
Edwin?
is,
Because I don't have the.
yeah, that is the next.
Yes,
Okay,
indeed,
so-
that's the next item.
Okay, Monique and Miriam, if you guys can bring us up as you conclude the first stuff. I think it's the first year for the task force.
It is. Miriam, do you want me to start or you want to start?
Sure, you can go for it.
Oh God, you don't sound good. Oh gosh. She's been working hard this weekend, I know.
This World Expo for 4 days.
I know. So good evening, everyone. I'm on with my co-chair to give you a brief update about the task force. And as Laquita stated, this is the first year we've kicked it off. And we've been pretty busy as the discussions around legalizing cannabis, it has become quite frequent. You guys might have realized, if you might have seen, hopefully already, that there's been public public messaging on the buses.
Yeah, these mobile vans.
I haven't seen a mobile van, but for the first time on the bus, I saw a commercial on TV, and I saw some advertisement somewhere else just to increase awareness that cannabis, the legalization of cannabis is coming, but it has to be done in a responsible way with a focus on adult recreational use. If I'm not saying that correctly, Miriam will correct me. But we've been busy, and at the end of last month, we attended a event that was sponsored by the Manhattan Borough President, who had reached out to a number of key community partners, us, our community board being one, and oh my God, the other major organization that focuses on
The Urban League.
Thank you. On the law, I'm telling you, I'm sorry, guys, because I'm under the weather myself. The Urban League and a few other entities were present that evening, but Mark convened a panel of some pretty heavy hitters who were representing different perspectives in terms of what this industry can mean to our community. And one of the organizations, of course, they had speaking was the Office of Cannabis Management, who began talking about applications for people seeking to apply to open up a retail setting, and going into a little bit of detail of what that might mean, though I think they're still trying to work out the details. They talked about, they had some other person who was talking about, oh, actually, I'm sorry. The one person who stood out to me, who for me, being a newbie, he really started to address cannabis from a very strategic and business perspective, and talking about what is being done in New York that's different in a lot of the other states, such as Cali, which we, every time we hear about the legalization of cannabis, people talk about California as, I guess, the place that didn't do it right. And New York is trying its hardest to learn from the other states so that we can implement it without having those pitfalls. And we all know that money is an issue. So money for accessing licenses and accessing real estate so that you can have a decent place to set up to have your business. Those two things could be a major block in terms of being successful. And the gentleman who spoke, I think his name was Ruben, and I want to say Santiago. If the last name is incorrect, Miriam, chime in. But he talked about what New York is looking to do, and that is to select a few individuals, I think like maybe 100 people throughout the state who are.
That, I'm sorry to interrupt.
No, go ahead, Miriam. Yeah.
Second license type, so far, I put it in the chat. Only
Okay.
2 of the 9 license types have been released. The hemp farmer, conditional farmers. So basically, the people who have been farming hemp in New York were giving the okay to plant cannabis seeds. They're farming as we speak. And the second license type, which was released, is 100 licensees.
Okay.
Will go out to the most impacted legacy operators, those
Right.
that were formerly incarcerated, but that really spent time behind bars. This is the letter that we approved at our last general board meeting, which was commenting on this set of regulations. This was really, bless you, Monique. This was really explained to us at the borough president's forum by the chair of the OCM, Chris Alexander, and by Ruben. This is very different than California, and people need to stop comparing New York to California, Illinois, Washington, or Massachusetts, because what they are doing, and there was some questions about this $200 million fund that the governor had promised, where this money was going. Well, it was clearly explained to us that the big difference with these 100 licenses, and they really encourage everyone, if you know someone who falls in this category, basically New York State is handing these 100 guys or women, whoever they may be, stores, completely outfitted locations, where this used to be a big money block for people applying for licenses in other states. They've done the work of finding out which will be the most trafficked, heavily visited places. They're going to literally give these guys locations at Barclays Center. They were talking Times Square. They were mentioning other places upstate because they want them to succeed. This is not social equity like California, that they tried to do it afterwards. This is happening before these guys open the door. They're basically being given keys to retail locations to make money. This has never happened.
Right.
So this is the regulation that we had everyone, that our task force reviewed, because it is extremely important that with every regulation that the board releases, community boards, specifically in communities of color, review them and input into them, because this is going to impact our community heavily. And we had 3 major legacy operators come to our task force giving us feedback into that letter. So it wasn't that it was just us members that came up with it. These were questions of guys in our community that are actually applying. So it's powerful stuff that's happening in our state right now. We will be coming through with more letters, hopefully, on every regulation, because this is a new law. We are going to have to weigh in on everything as a community board. And the perfect example is this is open to the public, but when we submitted our letter, we send everything on our letterhead and we send it to our electeds. When we were at the Borough President Forum, the deputy borough president, I forget her name, but she came up to us and she said, "Oh my goodness, I read your letter and I was fine combing it, making sure that I understood everything and I could address it to OCM as well." So the approach that our board is taking to do this as a task force is how it should be done. Not too many other task forces are going that way. But this is going to change our community, if you all haven't already noticed, with the amount of cannabis that is everywhere.
Yeah, everywhere is right. And those people are going to get caught up with eventually. So, for people who say, what about those people on the street with mobiles? They're doing their thing now, but I believe it's fair to say that they'll eventually get caught out there. And then they'll have consequences to deal with. I don't know what those will be, but
On another,
Yeah, I remember sending a text to Miriam, and I think I sent it to you too, Monique, that I had just seen a mobile van at Broadway and 109th, whatever day, it was a Saturday.
it's
And I think it was the second one that I had seen, and another one at some other location, but I gave you a text.
all over the city. There's events happening, there's lounges, there's stores, it's for sale everywhere. I just came from the Cannabis World Conference Expo. My brand was there for 3 days, and I don't know if any of you saw me on New York One. I was actually featured as one of the women brands in cannabis. I have a CBD brand.
No, can you text us the link to that?
The mayor was there. He came to the women. I was in a pavilion with 25 women-owned CBD and cannabis brands, and we were the feature of the show. The mayor came over. Tremaine Wright. I actually spoke with Tremaine. She came over as well. They're really looking at women to lead in this space as well. When we talk, when you look at the MRTA bill, it's not just legacy, it is women and minorities. And we seem to be forgetting that this bill applies to women as well. This is an opportunity for women, not just people who went to jail.
That's right. And that came up in the forum that we went to on the 25th, that was sponsored by Mark, that, women, this is an opportunity for women to, be entrepreneurs. And so at our last meeting, which was really robust, we had the meeting the next night. We talked about how can we get this information out in the community, because it's important. Information is coming quickly, but it doesn't do any good if it sits in if it's not being put out there. So Miriam and I had talked, and we're trying to see if we can actively do some sort of forum in the community that will work, and try to pull together some of those key people that spoke at the event that was hosted at the Forum of Columbia that night. So we were also looking at July in terms of trying to do something at the end of July, if we are able to pull together many of those key people that were speaking, because they are very interested in getting the message out there, and we want to help them do that. And Miriam and I, when we were at that event, we met with some of the representatives from our local CBs. What is it? 10 was there, I think, and 11
and 12.
And 12. And so, they're doing stuff already, and, there's mass power in numbers. And we talked about trying to coordinate with them to maybe, do some type of forum where, they're doing something and we can do something, and use that platform to get the message out, and try to get the message out as much as possible, so that we can reach those people that we know this is a once in a lifetime opportunity for them, and we want people to take advantage of it, because everything is being done to make sure people are successful. So that's it in terms of the comments that I have, and Miriam said a great deal. Miriam, you have to share the link for New York One. I didn't see you.
Yeah, that's what if you send it, I'd like to share it. I'd like to see it and then share it, you know.
I had a question
I
in
don't see
regards to
hands.
the, in regards to the 100 businesses.
Yeah.
You know, one of the concerns that some folks had was that folks that had a previous arrest with cannabis were going to be targeted by venture capitalists and, you know, have them share some of the ownership in these businesses. So from what I'm hearing is that these businesses will be 100% owned by those who had a previous arrest due to cannabis. Is that correct?
So the first 100 license types, you really have to look at the criteria for it, but it is very specific. It's not just that you were arrested, it's very specific, the type of incarceration and the time, if it was your family, if it was a relative. And again, it is just that you will pay for your license, and just for these 100 types, they will give you a location.
Oh, we should add
So
that.
there would still be some venture capitalists that can
They
target.
they still will need to secure their 500,000 or $1 million, whatever they need. They're still going to have to find that capital. Yes.
But
So
what
I think this is,
oh, well, Evan, before you finish asking your question, I wanted to just add that there are legal services that are available, so that people who are looking to get into this, and there's a lot of paperwork and legal wranglings that have to go on, and it's a lot. And this, you know, people who are new to this are going to need help in terms of understanding the legalese. And so Columbia, as we know, in the community business agreement, there is some clause for Columbia to provide some services to help support people in our community in general. But I think in terms of this forum that we went to the other night, Columbia has a oh my God, what was it called, Miriam? A legal clinic and they make themselves available to provide additional services to help people with those contracts and things of that nature, so that they're not being placed in a position where they could be taken advantage of. Miriam,
I think one of the things that, you know, we have to, you know, as a community is keep in mind that this is something that has happened to communities of color, right? You know, it happened after the war where folks were given loans, and based on where you were trying to get the loans, you didn't get it because of some type of engineer and how you were able to use it. We have to be careful that folks will be preyed, because to raise $500,000 to $1 million for somebody from our community, I'm not so sure how many people will get that type of money from the bank. And that is something that, you know, it sounds good in paper, but something to follow up on.
Hi, yes, I actually would like to finish speaking, because we all keep hearing predatory lenders. As someone in the space, someone who has attended many venture forums, someone who is in the process of preparing myself to pitch and aware of all of this, I was actually approached by venture capitalists this weekend. And you have to be smart, Edwin. You know, this isn't a bad thing. People think that someone offering you 30 million for your business is a bad thing for some people. Some people, that's what they want. You know what I mean? You have to understand that that is business. That is how this is going to be a new industry. And like Monique mentioned, as a community board, we really need to do the due diligence of putting out workshops, rallying our partners to help people navigate all of this free of charge, because there's a lot of ambulance chasers out there right now charging people money to supposedly help them with regs and do all of this. And they will be, a lot of people will be taken advantage of. But you have to, the terms, it's all in the details, and people will need guidance navigating contracts, because if you talk to a venture capitalist, traditionally, they will take 50, they will give you 51% and you get 49%. Is that a social equity type of deal? I had this conversation with a venture capitalist from Michigan this weekend who was telling me the same thing. Well, I can get you money, blah, blah, blah. And I said, my dear, we passed the MRTA bill. 51% for me and 49% for you is not social equity. Social equity means I get 70, you get 30. Oh, and he said, that's impossible. And I said, well, then I don't want your money. It's negotiating, and you have to be tough. If people are going,
But some people do need, yeah.
but that's the thing. If people need to understand what the MRTA bill is and fight strong, and we have to educate people to have those conversations and say equity and venture capitalism means 30 for you, 70 for me. What, you're giving me money? What do you have without my brand, my vision, and my essence? It's not easy, guys. This is a cutthroat business. This is not, people are going to give you money because they want to make money off of you. This isn't philanthropy. Venture capitalism is not philanthropy. It's negotiations and hard dealing. I had no qualms in telling this man social equity in New York, and he was laughing. I said, welcome to New York, my friend, and welcome to the MRTA bill. Social equity means you're willing to take less so that we can catch up.
So the second to follow up with that,
say that
is
to
that
someone offering them $30 million.
What? Go ahead, Edwin.
so the second to that is I spoke to one of the community members, and he was expressing to me that he felt that those folks of color who have lived in this community and who have also suffered from these policies that were harsh to our community as far as policing, but don't have a criminal background because of cannabis. He felt that he was being punished. He's like, why is it that I live on this community? I went to school. You guys probably, I'm not going to put his name out, but if I can bring him up. But, that is also, something that the community as a whole, he was concerned about the message that we're sending, that we're saying, look, you needed to break the law in order for you to partake on this.
Not at all, Edwin.
Oh,
Not
right.
at all. That's not the message. And that is why you need to understand this and go to their website and attend conversations. Legacy is not that you went to jail. Legacy is our community. Go to our schools. Look how they've been treated for the past X amount of years. Talk to Bailey about the environmental injustices happening in this community. The war on drugs was more than incarceration. It was a social injustice. It was the lack of equity. And this was clearly explained by Tremaine. You do not have had to have gone to jail.
So anyone from the community can apply for this.
License type. The first, you have to look at the 9 license types. The first one released, the criteria is for those that were most impacted. These are the guys that they want to help the absolutely most. These are the guys that had to have had a conviction of like, X amount of years, not like other drugs, but like specifically. It's very specific, the language, and every license type is very different. But legacy as defined by this agency and by the Office of Cannabis Management does not require you to have gone to jail. If you live in this community, you were impacted.
Right. Yeah, and that's the key thing, being impacted. We've all been impacted on a variety of levels, some more than worse, meaning those who went to jail, and then those, of course, who are from families for those who went to jail. I mean, that impacts all of us in some capacity. So with that said, that makes you eligible. And when that level of licensing comes up, then that will be another type of application that is presented with different criteria. But in either way, you need to be guided and walk through so that you know what you're signing and what you're getting into. And those services are available, or will be made available through the law students of Columbia through their clinic. And so that's very important. And they stress that so that people know what they're doing and they feel comfortable and they don't feel that they're being bamboozled into signing something that they don't want to sign. So
I have a question.
they
if I may.
stress that. Yes,
My-
Reverend.
My question is, and
Yes.
this might seem a little unusual, but say there's a person who might be eligible for this, who might want to have involvement in this cannabis venture, and they don't need backing, and they are a person of color, and they have the so-called $1 million. Now, we in the communities of color have witnessed this many times, and many times the federal government will take advantage of this and come arrest these people because they cannot answer as to how they ascertain this income. So what is the legacy offering people? That's part one. Second part, where can we ourselves look at this bill? Because within our own community, we have people that can read these legal documents. So I'd like to know what the website is where we ourselves may be able to read this documentation that offers people without going through Columbia or anybody else, you know.
And Reverend Caldwell, before you answer Monique, Miriam, I think you have some feedback that kind of muffles. We heard what you said, but there's some feedback. At least someone has feedback.
So
That's somebody else's line. I hear it too.
Yeah, okay.
Before I go and do this, I will just tell you, you just Google Office of Cannabis Management. We all have phones, we all have computers, we all have Google. You can literally ask Siri, Alexa, or Google, and it will take you to the Office of Cannabis Management, and everything is in there. You will need to inform yourself about the MRTA bill. It's also in there. This website is being populated on a daily basis. This office is growing on a daily basis. This is a brand new industry. They are not fully set up, but you go on the website this week and next week you go on it and there's more information. That's how fast this industry is moving. I tell you, I'm in this space and it is exhausting. 1 year in cannabis is like 10 years in any industry. The speed at which you have to keep learning, relearning, shifting and adjusting and sharing what you know is like something that's never happened before.
Now, Miriam, her question, the Reverend's question about if you are a person of color and you got $1 million to drop.
Well, you better like, this isn't, you know, this isn't the land of Oz, people. You're entering a legal business. You're going to have to show a paper trail. You're going to have to show a business plan. You're going to have to show a bank account. This is a legal industry you're entering. So if you have $1 million, you're going to have to say where they came from.
So assuming that they know where it came from and they have the money, to the question of the Reverend.
Letter that we submitted, folks, you all voted on it on general. For those that are members, we literally commented on this. This is when they're releasing each reg.
Yeah.
They're giving a commentary period because it's not perfect. You know what I mean? They're releasing this and some things don't make sense. We had a legacy operator from our community straight up say, are they going to give us tax amnesty? What's to say that we don't show up with our own money, that we say we had money in the bank, and then on a federal level, the IRS is going to come asking us to pay taxes for the money that we had. So this is why we commented that we actually asked for tax amnesty.
Yeah, we did. Any concern that we thought would, work against us as a community, we responded back in the letter that we shared at the general meeting. So many of the concerns that you're expressing, we responded in the letter that was sent back to the office. And so that will be for this one set of licenses that are coming out, and we'll have to do it again for the next 7 that are coming out in dribs and drabs. But, any concerns that we are identifying, we have the discussion with those who attend the task force meeting. We do the research, and then we write up the response and send it back, and it's reviewed.
When is your next, oh, I'm sorry, Monique.
Yeah, no,
When is
go
your
ahead.
next meeting?
So
Because Reverend Caldwell, for example, is new to the board, and even though she may have heard about it, read about it, she would know. There will be other people who may have missed something. So in addition to our reading, there's going to have to be some patience also, because there's going to be questions, or maybe some things are understood one way and not another way. It may not be the proper way.
And then when you
so there will be still questions.
And then when you understand, and then when you understand it, it will change.
Mm-hmm.
So what I was going to say, go ahead. I'm sorry, Laquita.
No, that was it. I was just saying that we're going to have a number of questions. And when is your next meeting? And you may have said it earlier.
No, we
but
didn't.
I know there's a forum, but I'm not sure if that's a meeting also.
No,
you said something about the end of June.
So we were meeting. So the meetings were being held the last Thursday of each month, and we are presently exploring whether or not we were going to change to do it on a Saturday in the morning. So hopefully, so that's still being debated. I think that we'll know before the end of the week, and then we'll set up to have a link available so that people who are expressing an interest can join us. So that's the first thing. The forum that we're talking about is different. This is something that we're trying to open up to the public so that more people are being made aware that this is happening and can be educated in terms of the opportunities. And we should stress that the opportunities aren't just to open up a place where you could purchase legal cannabis. There are other opportunities that kind of buttress off of this opportunity by itself. And we want to make people aware that you can be involved in helping to advertise, or doing advertisement, delivery. I mean, there's a host of different jobs that one could, if they were to put their mind to it, could create an opportunity in other ways. And those are some of the things that we also want to be able to talk about in the forum, so that people can open themselves up to all the possibilities that there are. So that's what I have to say about that.
Thank you for the report. I think that this is something we have to, stay on top on, and make sure that history doesn't repeat itself.
Yes.
There might be a few who understand what's going on, but history has taught us what this country can do to folks of color.
You're right.
You don't want for folks to be, using a license, but yet the capital is moving in some other direction. And so this is something that it requires attention from all of us, because just because it helps a few doesn't mean that it's trickling down to the community.
Well, Edwin, one last comment I'll make, I promise you, is this: whatever dispensaries are open up in our community, and I don't know how many those will be yet, because that's still yet to be determined. One, the goal is to make sure that these places are successful, and they go to the people who they're designated to go to, And for those that are successful, the goal is to see that money go back into our community so that it benefits everyone. That is the goal. So I hear what you're saying, right. We've been hoodwinked, before,
Yeah,
and nothing,
many
and nothing,
times.
and nothing's,
Regularly.
yeah,
Many times, and not just once, many times, and
I
the
understand.
devil is in the detail as
That's
to
right.
how things are executed.
Very, that's fair. And all I would say is the goal is to educate people and educate everyone who's here to ask questions, get answers to those questions, and then move forward from there. That is the goal.
I'm actually going to go as far as saying that is why I stuck my neck out at Community Board 9, way ahead of MRTA, to rally us to get ahead of this, because I knew this was coming. I'm in the space and I have not stopped since possibly 2017, pushing this board to get ahead of this, because this can be amazing for our community, but it could also bypass many people if they do not get ready. I urge you all to just stay on top of it. Community Board 9, we formed this task force for this very reason, because the devil is in the details. Advocates passed a law. It is up to communities to review the law and make sure the policy applies accordingly.
So, given that we have a task force, can you guys have a presentation for us so we can
Yes.
understand this better?
I think we've had many presentations. We're happy to do it for you, Edwin, but I urge you, this is something you have to go on the cannabis. If you question this law, you have to read it and kind of understand the background. We had a forum in 2018. I will happily reshare the exact same forum because it's the
Yeah,
same.
because they're new.
I think,
new
as you
people.
said,
Yeah.
Marion, these things change pretty quickly. So 2018,
Mhm.
The basis
4
of the
years later,
code has been the same
it's
since
changing.
2018.
But my concern is that we have to make sure that, structurally, this benefits the community.
Understood.
Yeah. Okay.
Okay.
So can we wrap up
Yeah,
a
we,
bit?
do you have anything
and-
else to add, Miriam?
I was looking to see if there were other hands up. I don't see any hands up. Let's see if there's anything else in the chat. No.
I
So
see Victor.
I think
Is-
that's.
Does Victor have his
Oh,
hand?
Victor,
Oh, okay. I'm sorry. I
Victor?
didn't see a hand up.
Sorry. Oh, sorry, that was from before, but I do have a comment. Can you hear me?
Yeah.
Yeah.
I'm
We could,
sorry from before. I didn't see it. Okay.
no problem. What we could do is maybe September general board meeting. You can do a presentation from the task force on some of the items that were raised this evening. That might be, something along the lines what Edwin was asking about. Maybe we could do something in September when we reconvene
Okay.
at that time.
Yeah, I mean, as Miriam said, there's a lot of moving parts, but we can see about trying to pull something together that distills it down in a simple sort of way so that people have an idea of what's happening, because it is complicated, but we can try to figure out how to simplify it a little bit for sure.
and perhaps since
OCM
it was mentioned that Colombia, it will be a resource with their legal department. Maybe they can also come in and speak as to how, we're going to make sure that folks are not screwed and the community is not screwed.
Yeah.
Because, I go back to what happened after the war. Folks were given loans. Folks were allowed the opportunity to go to school, but based on your color, you had certain limitations. And up
Right.
until this day, we're still suffering from
Mhm.
those policies.
You're right.
And, you got to be careful when they put, when they try to make things colorful, but you have to look underneath.
I don't think we can answer all those questions here, Edwin. As Miriam said, some of you are going to have to do research in your own. I'm hoping that at the general board in September, we can do like an overview to answer some of those questions, what you're saying. I understand exactly what you're saying. I've asked some of the same questions myself, but we can't do it here at this meeting. Okay.
Right, yeah, it's a complicated issue, but your comments have been noted. We'll work on that, and thank you for allowing us to share.
Thank you for the, for
Well, thank you
presenting,
guys
both
for
of
taking
you.
on this.
It's a lot of information.
Yeah, thank you.
Thank you, both chairs.
Now, moving to our last presentation, we are honored to have the Emma Bowen Community Service Center return with a presentation on one of their program components, a key one that they did not get an opportunity, just not enough time before to present. They have a department that deals strictly with child and adolescent services in mental health. Mr. Michael Zaretsky telephoned us and asked to be part of a presentation, and so we welcome that. And Mr. Zaretsky, if you would introduce yourself and your panel,
Will we
can
be
move
able-
forward on a topic that we've held on to since the beginning of this year, dealing with mental health. And there are a number of components, and this is a very, very important one, especially after the last several weeks.
Will we be able to share our PowerPoint?
Yes. Now, who should, let's see, I think Mike, Mr.
Elizabeth.
Zareski, I think.
Right.
Oh, Elizabeth, you need to be.
Right, Elizabeth will
Elizabeth
share
needs
the
to be-
PowerPoint and we're presenting together.
Okay, so I'll make Elizabeth the co-host. Or do I need to make both of you?
We're
I
both
have the
speaking,
PowerPoint.
but Elizabeth has the PowerPoint, yes.
Okay, you have the PowerPoint. Okay, so I just did that, Elizabeth. You should be able to present now.
So, Ms. Henry, I want to thank you for inviting us here today or allowing us to speak tonight.
Absolutely.
There are several members of our agency here along with us providing support, and Thomas Haggerty, our executive director, Patricia Jordan, our president of our board of directors, Jim Little, who is the director of special projects for the Bowen Center, are all here tonight to provide support and assistance if needed. My name again is Michael Zaretsky. I'm the Director of Child and Adolescent Services at the Emma Bowen Center. And we want to present a little bit about the mental health clinic that serves children and adolescent services and some special programs that we have and that we're developing to work with the public schools here in Northern Manhattan. I'd like to introduce Elizabeth Hanson, who is my assistant director, who's going to tell you a little more about our agency and some of the services we provide.
Thank you very much, Michael. As many of you know, Emma L. Bowen Community Service Center, we're located right here in your district on 145th Street in Amsterdam. And we have a lot of different programs, but as you said today, we'll present the children and adolescent mental health services. Right now, we have two different programs. One of our programs, the Therapeutic Nursery School, is for 3 to 5-year-olds. It's one of the very few programs in New York City that combines the educational program and mental health services. And that includes play therapy for the children, as well as guidance and support to the parents and caregivers. And it can also include medication management. And then we have the mental health clinic for children 5 to 21. So here we offer evaluation services, mental health services to children to address problems such as behavior difficulties, attention disorders, depression, anxiety. A lot of them have bullying experiences and school refusal problems, and children who are living with medical conditions who need extra support. We are a OMH licensed clinic, and our providers are licensed therapists and psychiatric providers. We provide individual and family therapy, guidance and support, like we said, to parents and caregivers. We do play therapy, group therapy, medication management, and we work closely with outside agencies in the community. So a little bit about the population that we serve. 17%, a little over 17% are African Americans. And then we have about 78% who identify as Hispanic or of Hispanic origin. And a majority of our clients come from, that we're serving right now, come from Community Board District 9. So a little bit about the problem in the community. As a community-based mental health clinic, we really see the increasing need for mental health services for children. Over the past couple of years, we have experienced an accelerated rate of children who are telling us that they are anxious and they have been worried about all kinds of things related to the pandemic. In the beginning, they were telling us that they were worried about getting sick, about their families getting sick. A lot of the children have had tremendous losses. And they were worried about, sad about not being in school, and worried about going back to school, about having to wear masks and not having to wear masks. And then over the last, I would say 3-4 months, we're really hearing from children who are scared and feeling unsafe due to the increased crime and violence. And I know that we said that the crime rate in our community maybe is not as high, for example, as in the Bronx, but psychologically, they feel like that's really something to worry about. And you know, most of our children, they are self-referrals, some referrals from ACS, but the concern is that all the children in the community are experiencing these same things, and many of them do not have access to the mental health services that they need. And as per Manhattan Borough President's report on school-based mental health services in New York City schools, 55% of African American students and 46% of Hispanic students never receive necessary mental health services. And as we know, unaddressed mental health disorders will affect their development, poor school performance, and it will affect their school attendance and place students at a higher risk of substance abuse, isolation, and suicide. And the same report notes that there's only one social worker for every 800 students in New York City. And principals who are interested in hiring school-based social workers may have to make program trade-offs if they want to prioritize mental health services in the school. And also with this new bill that I'm sure many of you have heard over the last week that has been approved to lower class sizes in New York City, schools, there's a concern that such trade-offs will become even more relevant. So we would like to have a program available in schools in our local community to make mental health services more available and easily accessible for our children here. And we have staff who are highly skilled, licensed therapists, psychiatric providers. They all have specialized knowledge and experience in tutoring children. We know that children and families of immigrant background need extra support and understanding. And what makes us different is that we have staff who has expertise in this area. They are from a variety of cultural backgrounds. They have a lot of experience in providing services to multicultural families, and they are sensitive to the needs of the recent immigrants in our community. And they have, in fact, 65% of our therapists speak Spanish and are bicultural, and 75% of our psychiatric providers speak Spanish.
So our Our goal is to provide easily accessible mental health services to children in schools and clinics where it is most needed in the community. So we want to get our staff into the schools. We want to be providing consultation to school staff, as well as providing assessment and support within the schools and from outside the schools. We are expert in telemental health services for families who may remain isolated. We can still work with them. We're open evenings and weekends in addition to our daytime hours. We want to break down the isolation for children and their families caused by the pandemic. As we know, and as Elizabeth stated, a lot of the children and families have been locked inside for a long time. They're frightened and they're scared, and they need support and help getting back out into the community and to enjoy their lives again. We have established ourselves as the principal mental health provider for recent immigrants in our community. As you are aware, we have a very large number of recent immigrants here in District 6 and here in Northern Manhattan. And we are very experienced in working with these families, and we want to make sure that we're better connecting with them through the schools and even through medical clinics. So
What-
we are,
No,
So
go
we're-
ahead.
Okay, so we are ready. We are ready to provide our services to the local community by establishing on-site clinical services in schools and in the district for mental health screenings and to set up treatment services. We're ready to do that. We have the staff, we have the programs available to do so, and we have begun to contact schools and clinics to assess the needs. So far, we're looking at 3 schools that we've had some contact with. IS 528 Urban Arts, Facing History High School, and PS 132, the Juan Pablo Duarte School. We are looking at those 3 schools right now, and we're hoping that we'll be accepted to come in and consult further with them. But we need your help and your support. So in some, did you want to say something, Miss Henry?
No, I was just, I know I have several questions. Go ahead, because you hadn't gotten to your summary.
Okay, so in summary, the M.L. Bowen Center has a children's mental health clinic with expertise that serves the local community. We've been here for many, many years, and we are familiar with the community. We will be able to provide mental health services to the schools with the greatest need in the community. And that's where we want our focus to be. We want to look at those schools that don't have the services that are needed for the children and families. And we want to place ourselves right there where the children and families are. We would like the committee's assistance in contacting the schools in the community where you see the greatest needs, or any other locations, agencies, services that are available that need our support and our assistance.
Well, thank you very much.
Wow.
Here you see our contact information. And if you need to make a referral, here's the information for the Children and Adolescent Services Intake Department, and also for referrals to any of ML Bowen's other programs. Here's the contact information for that.
How many public schools do we have in our district? I don't have that list in front of me. Is anyone right off the top? Does anyone know?
I'm gonna guess between 25 to 30 public schools from research I had done.
That involves districts that are located in community district.
District 6.
9.
Right.
Is the school
Well, it's
district
school
6.
district 6,
Yeah.
right, yeah. Yeah, and which stretches? Go ahead, I'm sorry.
No, go ahead. After you're done, Monica has a question.
Monica, why don't you go ahead?
Yes, we've asked you before. You came and you said that you've seen a 43% increase in demand for your services. And we asked you how much money would you need in order to be able to meet all the demand that you're seeing? And we haven't gotten a number.
Well, that's a wonderful question. I want to say millions and millions of dollars, but how it works for us is we are funded through insurance and Medicaid reimbursement. So for every child that we see, we are reimbursed for the cost of the services that we provide. So as we grow, we expand, we add additional staff so that we can see these additional clients. In terms of reaching out further into the community, we certainly recognize that there are expenses, and these expenses are tied into our income. So that's basically where it comes from. We also do some grant writing. The agency as a whole has a number of grants which also assists us in this. And we have a wonderful board of directors. I know Pat is here tonight, who also do a great deal of fundraising along with our executive director to bring in these funds.
Right. And I appreciate all that, but we're trying to advocate on the behalf of members of our community who need these services. So
Right.
when we ask you for a figure, we're asking you for a figure so that we can advocate with the politicians to make sure you get the money that you need to provide the services that are needed. So, you know, we appreciate the reimbursements. We understand all that. We understand that you have some grants, but we're asking a very specific question.
Yeah.
You came to us,
Okay.
you told us the increase. That's all we need to know.
Yeah, Monica,
Can I ask Monica a question?
if I could interject, this is Tom Haggerty. I'm the executive director. I am working with Ms. Jordan on that. And yes, there is an amount that we would want that could get us out into the community a lot faster and quicker if we had the money to support us with clinicians and psychiatrists.
Okay, thank you.
To piggyback on Monica real quickly, when I see percentage, I like to see the end number. What is that total when we look at increase?
So,
You know, because 50%, you know, out of one is 1.5. So, you know, we're talking about 48%. When I look at the presentation, all we see is percentages. You know, the end number was not put there.
Tom, may I quote from our budget for the new program?
Yeah.
So, yeah, so we are, for our new program, which is to be focused in our schools for the first year, we're looking at a little bit under $500,000 to run the program. Now that includes our reimbursement from insurance and Medicaid. So it's hard to say exactly how much additional money, but any another $100,000 to $200,000 will pay for an additional nurse practitioner, an additional psychiatrist, maybe 2 more therapists to be available. That would allow us to outreach that much quicker. It would also allow, one of the things that we struggle with is we compete with the local hospitals who have tremendous amount of grant money and private funding from various sources. So we have to compete with their salaries. We often can't meet those same salaries, but additional income. So if we had another $200,000 for this specific program, that would allow us to increase salaries to better recruit and bring in more staff.
Okay, thank you so much. I appreciate that.
There's someone else. Is that Reverend Caldwell? I'm not sure who. Let me see whose hand is up. Oh, there's several hands. Monique, Victor. Was Victor next? I'm sorry. I'm
So
just
the
looking
order,
at
the order goes Monique, Victor, and then the Reverend.
Okay.
Okay, thank you. Thank you so much. I was trying to hear the answer to Monica's question to formulate my question, because I think we know that one of the major concerns is that there aren't enough services in the community, and that is resulting in long wait times. And And I guess maybe I was trying to ask the same question. Or what do you need in order to eliminate the wait time or reduce it? Because I'm not sure if I'm even clear if you're having an issue with meeting the need that exists now, which I believe you probably are challenged because
Sure,
the need
sure.
is so high. I don't know what the wait time is for a adolescent to be seen at your facility, but
Well,
yeah, so yeah, I
yeah,
guess,
no, I hear your question, and it's a complicated question to answer. So first of all, we certainly do have a wait list right now. This particular component is meant to be a separate program that will reach out and try to break down that wait list so that we have staff who specialize in going into the schools. So in terms of that, what we need is, and where our difficulty is, I'm sure you've all heard of the Great Resignation. We have experienced some loss of staff over the last year in particular. So that is one of the things that has created a bit of a wait list. I would say if we went back to August, we had absolutely no wait list. We were one of the few agencies that had no wait list. I expect within the next couple of months, we will once again be one of those agencies with no wait list. I know that there are many, many agencies out there that have long wait lists or have even had to close intake because of staff shortages. We are, I think I mentioned before, we are competing with the hospitals. So we do need better funding so that higher reimbursement rates would assist us. Grants and funding would assist us so that we can increase salaries to attract what is a shrinking number of professionals in the community to provide these services. However, we almost every month have been adding at least 1 or 2 new therapists to the program. Do we still lose some people? Yes. So that slows down the process. But we are actively recruiting. We are actively interviewing. I could defer to Elizabeth Hanson, my assistant director, because she's the person in charge of all the recruiting and hiring. So do you want to say something about that, Elizabeth?
No, I think you said it correctly. We actively recruiting, and yeah, like you said, every month we're adding a couple of therapists, but it's hard. It's very hard in the field right now. We're competing with private practices who is going virtual. And a lot of therapists are jumping on that bandwagon and getting high salaries, and so it's hard. It's a hard environment in hiring right now.
all right. I mean, yeah, I guess that's the best you could do in terms of answering, but I do appreciate that. Thank you.
Was there a part of that of your question that we didn't get to that you want to ask or re-ask?
I mean, I heard your answer, and it's a hard question to answer. It seems like we're in a bind, and it's unfortunate from what you stated. You know, you're competing against other major institutions, though they seem to also be experiencing some wait times and not able to meet the need either. So it seems like we are in a quandary here.
Right.
So,
And there are different structural issues at different types of agencies. For us, we can expand as the clientele expands and grows. And we've been able to do that until this year.
okay.
Until this year. So there are new barriers that have come up for us this year. We are still recruiting. We can still hire to meet the need of the wait, so that we want to get all those clients in, just like we were back in August. And I am confident that that will happen over the next couple of months, again, because we're actively hiring. This is a good time to hire. All the universities are graduating their master's level social workers. They're beginners, but they're sometimes they have more energy than our old timers, which is really nice. They come in and with smiles on their face and lots of energy and ready to go. So we're very excited with all our new staff that we've been bringing on. So guidance, education, supports in recruiting are also things that we look for. I get on the phone and I try to steal staff. I confess, from other agencies who are calling us. I'm telling them, we're hiring. We're hiring. If you're interested in making a switch, we're a nice place to work. We have a wonderful board of directors who are really supportive. We have a wonderful administrative staff who have been extremely supportive and provide us with a great deal of guidance, and we have a very, very dedicated team. So
All right, well, thank you.
you're welcome.
Victor? Victor
Yes.
was,
Yes, my question is regarding, I know you mentioned new immigrants to the community. We have a growing African population. Actually, there's a mosque on Convent and 148th, 149th. Many speak French or other dialects. Is that something that's being addressed? Do you have someone that can speak to them, speak their language?
I would have to look a little further in that. We have had French-speaking staff. We unfortunately recently lost a psychiatrist who was also African from Nigeria, and fluent in French. And again, with the Great Resignation, there is a loss of staff from time to time. Elizabeth, do you know if any of our therapists speak French?
I think so, yes.
And I know you speak
One
a
of
few
them.
languages yourself. I don't know if one of them is French, so.
But yeah, but we do have one of our newer therapists speak French.
Okay. All right.
So,
Thank you. Just a
and
concern.
if you, and Mr. Edwards, if you want to
Yeah.
get us that information, we would be glad to reach out to that mosque and see if we can provide supports and services to them.
Oh, great, great. I often see the young children, following behind the parents. I know they're in school, so their language is, English as well, but I see some of the parents seem like they only speak French or another language. So,
Sure.
but I will get that information for you. Thank you so much.
You're welcome. You're welcome.
So Monica, you still have a question? Your
Oh,
hands,
my.
your hands up.
Get my hand down.
Let me see.
yeah, put
so-
the hand down if you've already asked the question and don't have another one. I know it's
So
easy
I
to
would say
forget.
that, given the environment, if you look at the data that exists now, kids and teens, they're dealing with more mental health issues. And that's the trend nationally. We would love to have you guys join us in July as we try to address, gun violence. And this is a very important aspect because we cannot address it if people are dealing with depression, anxiety, and sometimes, violence is how these emotions get manifested. And for folks to know that the resource exists right here in the community, I think is very important. So, it will be very nice if you guys can join us because I think that the services that are here in our backyard are very much needed for many folks in the community, parents, kids. We're all coming out from a very, still dealing with a very tough time during this COVID era.
I'm not sure if there was a response that you're about to make. So there are about 20 public schools, elementary schools. In terms of high schools, there may only be 2 or 3 in our district. Do you know for sure? I think it's not many. I know that much.
And
2 or 3.
Yeah.
And there are also, I assume, parochial schools and private schools in the community that need our services as well.
And I will also echo, Michael, that we have CBOs in the community that deal with various issues, such as, housing, I can think of Palante. Many folks show up
Yes.
to them on
Yes.
distress. They will be able to help them with the housing issue. As far as the mental health, it will be nice for other CBOs in the community to be able to know that you exist and to give them the information to follow up with you.
Sure, sure. And just to follow your response, we do have a community health fair every year in September. And we invite many of these agencies to come and share their resources and information with the community. So we would love to get to know more of these agencies. And we're talking about going out into schools, but there's no reason why we can't connect with other community organizations and agencies. We do connect with many pediatric clinics. We connect with preventive agencies and a variety of agencies, Girls and Boys Club, that work closely with children and families as well in different ways. And we find that a multi-systemic response to the children and families' needs is also very helpful. Kids don't just need mental health services. They need some place to spend after school that is constructive. They need a police athletic league where they can get involved in sports, and they need a Boys and Girls Club where they can be safe, and other after-school programs and activities. I think someone earlier mentioned something about work and jobs for youth, and also very important to keep kids off of the streets and give them constructive activities to do in the community.
So what is, you mentioned in your presentation that you wanted our assistance. Can you be specific about that again in terms of how you see us assisting the child and
Sure.
adolescent programs and
Sure.
services?
So we're already beginning to hear about agencies that we can connect with and collaborate with. We need help and guidance connecting with the schools. That's been a slow process. We would like to move faster. There were some questions about finances and money, and if you can guide us to businesses and corporations and organizations, government or private, that you think we should be reaching out to provide funding and supports to us, that would also be very helpful. Our hands, our arms are open, our hearts are open, and even feedback on what we're doing, where you think we're making mistakes. I'm glad to hear that you're very aware of the wait lists here in the community. And we are very familiar with that. So supports in that area. You might have, Ms. Henry, you might have a friend who has a young person who's graduating school and wants a career in mental health. It could be as simple as that. If you know that there are children at X school that are really struggling and need services, then we'll reach out to that school. It's hard for us to know which are the schools with the greatest need. And you represent the community, so we're hoping we can get more guidance in that direction also, and who to contact. We've been in contact with some representatives from District 6, but it's slow going.
I
Yeah.
hope that with the meeting that we will have, that we can have a multi committee, because if you can't do gun violence without speaking to the principals of some of these high school, they know where their needs are, as you mentioned.
Right.
So it yeah, we'll follow up on, hopefully you can join us. But we can have a conversation with everybody at the table, and then they can know that, hey, this exists right here.
Sure.
And we should, our Youth and Libraries Committee, I think they actually, a couple of representatives did come to one of the meetings. I think it was the first meeting that Emma Bowen presented. I think that Deirdre was here. I may be mistaken, but otherwise there's the youth libraries and well, maybe it's, there's youth libraries
Well, yeah.
committee.
Yeah, I
that
was
we
gonna
could
suggest
get
that. Yeah, they should
involved.
definitely speak at that committee.
Is that
Yeah.
the meeting on the 14th? I know there's a
Yes,
committee on the
and so
14th that we're trying to get on
and
there.
we could alert them that, you know, if you're available to present as you did this evening, we could alert the co-chairs. And if you could make that one, that would be really important,
Yeah.
as well as the meeting that we would do on violence, or that we would be planning on violence, gun violence in particular.
We could put together a brief presentation on the impact of gun violence on children with, the children that we work with are struggling with issues of trauma, abuse, depression, anxiety, and in some ways it can have a greater impact on their well-being. So,
and then when you
more
present
sensitive.
directly to that committee, though, it could be more all-encompassing as you did this evening. But when we have our specific point to make regarding gun violence, then that would be where you would concentrate on that. Would there be a need, as you're seeing this, for a letter of support, that kind
would be
of thing?
that we always would welcome a letter of support. That can be helpful when we are seeking funding. Oftentimes when with grantees, they're asking for in the applications for letters of support. So that would be wonderful if you could provide a letter of support to us. That would be brilliant, and it's thank you for suggesting that. So,
well, but that would not be what you would be seeking in reference to going to the various schools.
No,
or reaching out to the various schools. That would not be needed.
If you know principals, guidance counselors, school social workers who you can help us connect with, that would be beautiful also.
I think our outreach to the co-chairs of youth education and libraries would be a big start.
Okay, we will do that.
I have a quick question, but I see Heather's hand is up.
I'm just going to participants now. Heather and then Monique.
Yeah, you all just covered, I think, most of what I was going to ask in terms of the Youth Education Committee and reaching out to the school counselors. But just one other thing. I'm just wondering what the capacity is of your facility in terms of what type of numbers are you trying to increase your numbers to? And what services are you providing right now that or what services do you plan to provide that you currently are not providing through the schools? I'm just curious if you could just be a little more specific.
Sure. So we certainly get referrals from the schools. That occurs, but we don't feel that we are actually connected well with the schools. So families are given our name by school counselors, principals, guidance counselors, social workers, but it is often a struggle for us to connect with the schools, the school personnel, the teachers. If we're present in the schools, then we will have greater access. We can collaborate more. Interventions need to be more than just coming to therapy. We need to.
But what is your capacity?
What is our capacity?
Yeah, because
Sure.
I'm a little familiar with your building, and I just noticed in recent years a lot of vacancy in terms of rooms, and I'm just wondering if that's changed.
Sure.
So what is your capacity?
Sure. So our capacity actually is, I have to say, due to telemental health, is the sky is the limit.
Okay,
We don't need office space in the same way that we did need office space. For example, we have almost 600 clients right now that are being seen in the children's clinic. Another almost 20 clients being seen in our therapeutic preschool. The therapeutic preschool has additional space. They're waiting for approval to expand. And as far as the children's mental health clinic, we're on site 2 days a week, but the rest of the week we are providing services via telemental health through Zoom, phone call sessions, and it keeps us pretty busy. In fact, some families prefer that now. There's still a lot of fear of getting sick in the community. It also, we don't have to worry about our attendance went up during the pandemic. Families, you don't have to worry about it raining outside and not having an umbrella, which is the truth for many of our families. It's hard for them to travel. They don't have the bus money, the train money to get back and forth to sessions. We try to help, but it just has made it so much more available to the community by providing services in that way. So when you ask what our capacity is, as long as we as long as we can recruit enough staff to provide the services, we can continue to grow. A year or so ago, we were up to 650, 660 clients, and we were looking for more, and we're still looking for more. Unfortunately, we've lost staff this year. We're rebuilding, and as long as we continue to be able to hire, we can continue to grow. So our adult clinic, for example, has over 2,000 clients, and they have room and capacity. Some of our programs are a little smaller. We have a chemical dependency program that's wonderful, but they have capacity also. So as long as we have the clients coming in, we are free to hire more staff. And I think our board and executive director would confirm that for you. I know some agencies, I recently had a dialogue with someone from the Jewish board. They have a whole lengthy process they have to go through in order to hire a new staff member. They have to get approval from administration. For us at the Bowen Center, we've made things very easy and very simple. The bottom line is we're here for the community, and we will hire the staff that we need to provide the services that are needed. Does that
okay,
answer
thank
your
you.
question, Heather?
Yeah, thank you for that clarification. I just wanted, because there's such a vast number of, such a great need in this community.
Sure.
I was just wondering if you could handle it. What would be your high end number of, what number, if any, if you knew that you were trying to get to?
So the bottom line right now is we need more staff. So
Okay.
the right now, my immediate goal for the year, I'd like to get us back up to where we were last year. I'd like to get us up to maybe a little higher, up to 700, 750, and continue to grow from there.
Okay, thank you.
You're welcome.
And we have several
Monique?
shelters. Oh, sorry.
Oh, I'm
Hey,
sorry.
go ahead.
Go on, Edwin. Go on.
Go ahead, Edwin.
We have several shelters in the
Hey,
community.
Monique, and then
Do you guys work with them? Do they reach out to you?
More of our adult programs and our substance abuse programs are reaching out and visiting them, but they do promote the children's services just as they promote the adult and chemical dependency services. So that is a very active route for our agency as a whole.
Do we have family shelters in the community? I'm sure we must.
Yes, there is the Convent Avenue. I'm sorry. Yes, there's the Convent Avenue Family Shelter, and also one other, which was part of West Harlem Group Assistance, but definitely the Convent Avenue Family Center. And most of those families are referred through HPD, who have become homeless as a result of fires and vacate orders.
All right. No, I asked because to me, it makes sense to go to a family shelter
Yeah.
because children are
Mm,
there and
Yeah.
they would be in
Yeah.
need of services. And I wasn't
Yeah.
sure how many were in our community, so I'm hoping
Yeah.
to follow
Yeah.
up on what Evan was
Yeah.
asking, if that you're
Yeah.
making contact with those
Yeah.
facilities.
Yes, we are.
But my,
And yes,
And many of those children come to see us.
okay.
We have quite a large number of homeless families who come to see us.
How are you guys advertising your services? And I asked because, as was alluded to by some of the other committee members, it's hard to tell, you know, what kind of activities going on at the facility. And the signage, you know, it's been there since I've been a resident in a community for a few decades. So it's hard to tell, you know, like what's going on and how active and vibrant, or what the resources are available. So how are you getting the information
Sure.
out into the community to let people know, you know, that you're there, even though your building
Sure.
is there?
And do you have any wraparound services?
yes.
Sure. We have a lot of, Pat, you want to share?
No, go ahead. Go ahead, Michael.
Oh, okay. So we have quite a lot of services. We used to actually list each and every service in our presentation, and we felt it was important to focus in on the children's needs. But one of my favorite programs is our food pantry, which is open to the entire community, and it has expanded during the pandemic. We have a very large, very successful adult mental health clinic that continues to grow in leaps and bounds. We have a chemical dependency program that works with both youth and adults. They have a specialized program for 12 to 18-year-olds. Sorry, that's my phone. They have a program that works with 18 to infinity, as old as they want to come to the program. We have a residence in the community that provides a halfway house, Able House, which provides residential services to those in recovery from substances. I believe it's a 20-bed facility. We have a care management program that currently provides care management services to adults, and is soon to be also adding a program to work with children as well. We have Rainbow, which is a not a halfway house, excuse me, I mentioned Able House. We have Rainbow, which is a clubhouse for those in recovery from mental health issues. And they provide job placement, job training, educational supports, recreational supports, socialization supports and skills. They'll even teach you how to cook a little bit. So a wonderful program. And Pat, I'm sure I left out 2 or 3 more programs.
No. Well, just to add to that, Michael, the care management, that program will make home visits to the homebound, and also they serve as an advocate for the clients. A client may need to have their Section 8 recertified. They may need to get benefits from HRA, Human Resources. So they're there to provide all of those wraparound services. And there's sometimes their immediate needs where a family individual might need an air conditioner. We don't advertise this because of the excessive heat and they cannot afford it. And this is going to impact their mental health services. So in essence, we try to provide all those supportive services in addition to the mental health services in order to make the person whole. So that is the care management program. And in terms of advertisement, we have a pretty robust newsletter that comes out just about bi-monthly, as well as our social media platforms. And we recognize that some individuals do not have access, to these mediums. We make available, we have brochures that we distribute to various parts of the community. So we try to get the message out as much as we can. And anytime that the community can speak on our behalf about our services to those who may be in need is very, very helpful as well.
Are you
And-
providing any methadone maintenance or the
No, no.
alternative? You're doing
No,
the alternative drugs?
Right,
No.
yes.
Okay.
You talk about giving brochures and newsletters. And once again, I don't know how that's disseminated. Like, do you
Yeah.
have to walk into the building and get the
No.
newsletter or
No, we-
brochure?
Yeah.
Or is-
No, it's newsletter is online, and we understand that some folks don't have access to the newsletter online, but we try to distribute brochures to the various schools, to the community organizations throughout. And anytime there is a community event taking place, we are usually invited, and we come with staff and also brochures on all the programs and explain the programs to anyone who would like to have that information. And any other suggestions you have, we welcome it.
Well,
And
I
I-
would,
I
one
can-
thing I would suggest, and we
Yes.
did this with some work that we were doing on this committee, you know, the
Mhm.
kiosks are in the community and those
Mhm.
kiosks are visible, and you can
Yes.
have simple messages and things
Mhm.
on the kiosks right on the corner
Mm.
across the street from your center.
Yeah, so
Um,
we work with them as well. Okay, and we will
Yeah.
definitely follow up.
You
And
should
going
definitely
back,
do that, yeah.
okay, and going back to the old signage, we've been going back and forth. It's a costly process, and it's a lot involved. And every time we try to make a change, there's so many hurdles to go through. We think we'd rather devote that time to working with the clients than trying to deal with that bureaucracy.
Fair enough, fair enough. Maybe if you use the kiosk and other
Okay.
things, that would
Okay.
bypass the
Sure.
signage, because that's
Okay,
more
okay.
And
vibrant.
Okay,
I'll
okay. and
send
it-
Miss Henry, I'll send Miss Henry some literature that she can distribute as well.
Terrific.
Yes, yes.
Okay.
So, and
Yes.
then just, I'll make contact, with co-chairs of the, youth committee. And if anyone else, has, any leads or other, suggestions other than the ones named, or, with telephone numbers or someone you would mind, following up to on behalf of Emma Bowen, and the children there, just either let me know or you have the contact information. I believe, the email addresses are part of the agenda. And if you didn't get the agenda, it was emailed, but I can always get it back to you.
Oh, I
if
did,
it's
I
with
did
the
receive it. I think
email
one person-
addresses where you can
Yes.
make direct contact. No, I was talking to say the other committee people who may have ideas or suggestions that they want to give to you. They know how to reach you through the email addresses that are part of the agenda, that were put on the agenda form. Okay.
And we'll send you
Um,
everything tomorrow, so you have it.
And I think also to be at Victor's strategic planning meeting, from what I recall that you were going to discuss, Victor, what do you think? Maybe one or two, maybe their participation or being there. I don't know if Victor stepped away for a second or not, but I'll email his agenda, as I mentioned earlier, too. His meeting notice, Zoom notice.
Thank you. Much appreciated.
Mhm. Thank you very much for your presentation and for coming.
And
Thank you all.
thank you for welcoming us
know-
and being there to
Yeah, and thank you for the work you all are doing. It does have an impact on people's life. And, we appreciate it. And anything that we can do to help you, bring staff member, bring, some funding, always reach out to us. Because, these are services our community need.
Absolutely.
And we thank you.
Thank you.
May
And
I,
if
may I
everyone
just,
would stick, if
hi,
everyone would
so-
stick around for a second, we have our last
We have
presenter,
Mr. Charles.
Charles.
Yeah,
Charles
go ahead.
kind of he popped in on us. He's been with us before, but he wanted to say a few things as executive director of the Ryan Health Center.
Right. And I wanted to actually piggyback. Good to see you, Miss Jordan, and my
see you.
Bowen colleagues and everyone. And actually, it's 6 degrees of separation. We don't do this work in a vacuum. I'm actually going to talk about Convent Avenue Family Shelter. Mr. Zareski will follow up. But thank you, everyone.
Oh, that's
Just
good
really
already.
quickly, I'm Charles Shorter, Executive Director of the Ryan Harlem sites. Ryan Adair, which is in the old Sydenham Hospital at 124th and Manhattan Avenue. And then our fairly new site, which is not so new anymore, is at 128th and 8th Avenue. And we're longstanding partners with the Bowen Center and Heritage Health and Housing. We attend the annual health fair. We have a mobile health van. But the reason that I'm here tonight really quickly is that for a very long time, we also had a small clinic in shelters, including Convent Avenue Family Shelter, Family Center. And it was a small clinic, and it was a part-time clinic where we provided primary care to the folks. And as Miss Jordan said, Convent Avenue is actually an HPD transitional family shelter. So families are not mandated to see us, and in the past, we've had some very productive relationships. But right before the pandemic, we were seeing about 10 to 15 families in a 6-month period. It just wasn't very productive. We also, because of the great migration and resignation, we've lost several staff members. We're just coming, the Ryan's network itself is just coming out of a really horrific staffing issue, particularly RNs and nurse practitioners and medical providers. So we closed it was a part-time clinic. We closed it in March of 2020 it was suspended temporarily due to the pandemic. It has been closed since then. Our regulations, unfortunately, we have to inform the community that we're going to be permanently closing the site. That's in itself sounds like really horrific, but the site has not been open. And conversely, the families that have been getting services have been getting services at Heritage Health and Housing, City Care, the 2 Ryan centers, Lotus Health and Wellness, and Advantage Care. So, and we work closely with the families to make sure that they get the care in the community. So the physical small clinic at the site will be closed as of August, and as regulatory, I have to come in front of you and let you know that that's happening. But we do have a plan in place, as I mentioned, and the tenants are informed that they can see any of the other centers. I would love to talk to Mr. Zarensky, and I'll follow up with him about the Convent Avenue. I know that they reach out. It is a family shelter, and it's about 60 to 80 apartments at 26 Convent. And so that would just be a wonderful opportunity. We continue to serve the community. Any questions?
Thank you, Charles. I had not forgotten you, by the way.
Yes, now I know. And I need to get back, so this is actually, I need to be here with you guys. I'm at my main office is at 124th and St. Nicholas. So I sit right between 10 and 9. But you guys and I'll once the summer's over, and I would love to sit on a strategic planning meeting with you. Gun violence is unfortunately Ryan Adair at 124th Street. I came in one morning and our windows were shattered. So that we're next to the New York City Housing Authority, and there was some gun violence, some shooting. So it's a big issue, and however Ryan can assist, I'm there as well. Thank you.
Monica has a question.
Yes.
Monica Zula, and then let's see. Oh, Monica, and then Monique. I'm not sure if I saw the hands, correct in the correct order, but bear with me. Monica, Monique, and then Miss Jordan. Okay. Monica.
Yes, Miss Zula. Hi.
Can you go over what you're closing again? And that's the first question. And is Mount Sinai offering you any support?
So we actually have a longstanding relationship with Mount Sinai, and we're a community health center. So we're federally qualified health centers as in Heritage. So we actually had a small part-time clinic that was open 1 day a week. And it hasn't been open since March of 2020. It's been suspended because of the pandemic and then continued to be suspended because of shortages. So we're permanently closing that clinic, but it has not
Where is
been in
that?
operation. It's at it's in Convent Avenue Family Shelter at
Okay.
26 Convent Avenue. It's
Okay.
in one of the apartments.
Okay.
Okay.
And that's the only thing that you're closing?
That's correct. That's
Okay.
well, permanently closing. It's been suspended, but we're officially closing it and taking it out.
How large a staff was there that 1 day a
There
week?
was one nurse and one nurse practitioner that rotated once a week.
Okay,
Yes.
okay. Monique?
Yeah, sorry, that was the same question I had. I wanted clarity on what you were closing, but the two community-based health centers are still open and
Yes, they're open, and yes, absolutely not. This was a small part-time clinic that, again, hasn't been open since March of 2020, the beginning of the pandemic.
okay, thank you
And
so much.
Ryan Adair, oh, I'm sorry, Ryan Adair is also a federally
Yes,
funded
Ryan Adair is federally
clinic as well.
qualified. Ryan Networks, all of our sites are federally qualified health centers, as in Heritage Health and Housing. Correct.
Okay, okay. Pam, Ms. Jordan?
Oh, just one, I wanted to thank Mr. Shorter. We have a great working relationship with Ryan. They've been very supportive of Boeing, and it's really a good working relationship. And in terms of convent, we had met with the director just
Yes.
before the pandemic about having a closer way of establishing a formal referral system. And there was some change in their leadership. And I think this is a great opportunity to reestablish what we had planned to do just before the pandemic.
Right.
So thanks to
And
all for
we would
bringing
love
that back to
we
us.
would love to be the bridge. We have such a great relationship with both organizations. If you please reach out to us.
Okay, we shall. We shall.
Very good.
Shall we move to the next item?
So that concludes our presentations. I will do what I need to do in terms of follow-up, and everyone else has their follow-up assignments. And I think we're concluding the presentations on a very positive note for the need that is in our communities. So of course, there's more work to do. And so just all the presenters stay posted, you know, for what's coming up in a few weeks. We're going to try to, you know, have that jump off with gun prevention, gun safety. The next item after that deals with the Mental Health Coalition. Edwin and I had a couple of conversations around when we started this whole idea of discussing mental health and how important it is in our community. And there are so many facets. And Edwin said we should have a mental health coalition. And I'd like to just take some moments now to have each person give an idea of how they think that can work. Edwin, you I know have a general idea, but maybe we can hear, we've talked about it, but it would be great to hear just a couple of things from the committee members to see how they feel about it. And certainly everyone who is presented, we're hoping would be part of this coalition. Edwin, you first, and then, you know, we can go around with the committee to see, get their response.
One of the ideas that we had was to have a coalition in the community where everybody speaks to each other and everybody knows of the resources that exist within the community. You know, the Emma Bowen Center, we just find out about the center, you know, a few months ago, and it has been here for some time. And that
No, some of us, I live up here, I walk past it, I've referred clients to them.
Yeah.
Some of us didn't know about it.
Yeah, some of us didn't know about it. And the idea came up that we should have the conversation taking place where we all speak to each other and know the issues affecting the community and some of the issues that our, local organizations are facing as far as also trying to get grants. One of the common themes that we keep hearing is staffing and competing with a big institution. So this is something that, it has to be brought up back to, our electeds and saying, look, our organizations are saying that they have job openings, but they just can't compete with big institutions that have departments that write grants nonstop. So we have to make it more palatable for our small organization that have a better sense of what's going on with the community to also be able to compete when it comes with salaries and benefits. So these are some of the things that can happen when we all talk to each other. And we want to get your ideas as to how you would like to see a coalition in which CB9 is one of the players, but this will be run by the players that will be joining the coalition.
So what feedback, how do you guys feel about that? I like our idea. Of course, how you guys feel about it, or what else do you think we should undertake, or how do you think it should run, and other things you think it should consider?
I mean, I'm thinking about how some of those institutions have come before us and state that some of their staff have stated that they have issues in terms of not having enough manpower or woman power resources to administer or render care to the people who are coming in to be seen. So these are big institutions, but they seem to a degree to be having their own limitations in terms of what they can offer. So that's why I'm laughing, because, maybe those people who aren't happy at the bigger places like a Mount Sinai, they could seek opportunities at some of these smaller places for one. That would help maybe. But as you said, money is an issue, being able to compensate people. So.
Okay. Well, that's one of the things that coming together as a coalition, we can at least bring it to the attention, and then people can know what's happening and maybe make some change, maybe know someone who wants to do something a little different, share information, and get a lead to another opportunity.
Well, I think that will work with Quita. I mean, I don't know if people are talking to each other. But right now the name of the game is get resources where it's needed. And that might be an avenue where we get politicians to do something, actually do something, actually give some money where it needs to be given.
So Monica, when you say give money, what, discretion, using the discretionary money to help the organizations?
Absolutely. And help us advocate with these agencies to get stuff funded.
Yeah.
I mean, some of these white communities, the politicians, they make sure that there's a coalition of this, a coalition that, and they make sure that they get money. In our community, nothing happens because we don't hold people accountable.
That's
This
right.
is our number one issue right now. With what I see, I have clients who have to wait 4 to 6 months to get treatment. And some of them have to sit in jail until we find a space. Some of these kids are acting completely insane. It's a national issue. Principal associations are talking about it. It's happening in urban, suburban, rural communities. They are dealing with things they have never had to deal with. And it's because these kids are just on the edge.
Yeah.
And as we saw in some of these presentations, they have some of the data of what it looks like for them. when we have a coalition, we all can share that information and come back to our politicians and say, we need money here. You know, we have several organizations who are ready to provide the service. They can hire people because we don't have enough money. So if you want to get reelected, we need more money. So this will be good, you know, because when we all talk to each other, we can hold people accountable.
Yeah. True.
That's been good feedback.
Yeah.
Anyone else?
Yeah.
So we kind of draft something, Edwin, and then invite, certainly I think we have a good number of organizations to start with. Everyone that has made a presentation here since, I can't remember since January, but even before January, because West Harlem Development Corporation gave out 10 grants to 10 agencies, human service, that have human services as part of their program. And some of it is under the human services umbrella, but there's mental health, there's kind of a big brother organization that can help. And then We All Really Matter advocacy groups that deal with stress, mental health issues. So, and then we've had about 10 others present. So that could be a good start.
Yeah, and I
with what
think
we
with
have,
this,
and invite them to that session and have them introduced, and yeah, we could talk about how we would unfold it, have it
and we can
unfold.
also have the clergy, because you know, they have a pulse on folks in the community. People come to the
Yes,
churches. So in this coalition, we should speak to our churches also, so they can, you know, tell us what they are seeing, because you know, the CBOs, they're getting those who are, you know, somewhat motivated to seek for these services.
mhm.
But we also need to get those who are in the periphery, so they can know, look, you know, this exists right here in your backyard, and you can have access to it.
And that's a great idea. And Reverend Caldwell, you're new to the committee, but that's where we could, you know, press you into service a little bit there to help us out in that outreach. You know, a few churches be part of this coalition in the start, and then of course more as they become aware of it and feel they want to be a part. Others? I hope nobody else went to sleep on me.
No, still awake.
All right. So that's
Okay, so
You didn't get
that
back to
was
me, but,
the new business. I think that's good.
I'm sorry, who was just talking?
Hold on.
Me,
Laquita,
So
one thing,
oh,
the rats. We have got to get the Department of Health. They have not done anything for 2 years up here. And the rats are taking over on Amsterdam and Broadway and Hamilton Terrace.
Yep.
And they have not I have not seen them put up any flags or signs for the last 2 years. My understanding is that the mayor cut the budget for the rats, but I mean, it's insane. It's insane.
Well, how would he do that? He probably said, I don't see anywhere. He wasn't seeing it because they were being treated.
Well, probably,
goodness.
but I mean, it's a problem throughout Central Harlem. Like, I walked my dog down the hill and I thought this rat was like going to attack my little puppy dog. But
yeah,
it's all over, and it needs to be addressed. The same amount of attention
he uses to arresting people. He needs to use to doing something with these rats, because they have not put down anything for the last 2 years.
I thought that there was a rat academy.
There
Literally.
is a rat academy, but that doesn't make up for the Department of Health not putting down stuff in the community.
I got you. I mean, I would add to that, and I know I've mentioned this before. I mean, the garbage can situation is, there's like no garbage cans. And so people throw food and stuff on the street.
No. That's some bullshit that the media tells you. There's
No.
no garbage up on Convent Avenue, but we got rats.
Well,
there's no garbage on 142nd, 43rd, 44th, and we got rats. So
well,
we need to do that.
So Monica, that doesn't negate what you said, because they're right. There are rats. I've seen them myself, and it's not pretty. But I'm also saying that we need garbage cans as well. That's what I think both are true.
Right.
So call to action. Okay, so the sanitation department of
no, that's Department of Health. Department of Health takes care of the rats.
Oh, okay. Okay.
We had an email going back and forth about a rat situation on 148 with them, in which Sean Abreu and his staff members, they were part of that threat. What we can do is just reply to that and say, the concerns that were brought up about this rat situation throughout the community.
Yeah, it definitely.
And doesn't that person, okay, the reason I was thinking of sanitation is because they meet with youth or with the cabinet, that person, but it's not sanitation. So I guess we can't call on that source. What is the role that they play? Sanitation.
Sanitation?
Sanitation just has to do with the garbage. But Department of Health is the people who deal with it.
The garbage.
Mm-hmm. All right, so I have a call into Pauline at Department, Pauline Ferranti, and I thought she might have peeked in at this meeting. I texted her last week. So
sanitation hasn't been at this meeting in a while.
And they still need to sweep the streets.
Back in March. They were back in March, I think. If it wasn't March, it was
I think we
February.
invited them, but they never showed up.
Right.
Yeah, there was a woman. Yeah, there was a woman. Sanchez was her last name. Was Susan Sanchez?
No, I think that was from the FDNY. We have FDNY coming in, but not
sanitation hasn't
not
been here.
No sanitation. We
That's what
invited them and they didn't show up.
That's how, yeah, I think Edwin is right, because I
We had the FDNY folks.
I definitely wanted to comment on the lack of garbage that was being swept up from the street. I mean, I saw a street sweeper come by for the first time a few weeks ago, and I remember complaining to Mark about that there was garbage in the street and it was disgusting. And I wanted to ask the sanitation representative the question about what was going on, and they never showed up. So I don't know if we can get somebody from sanitation to come, and also someone from DOH to come to address the rat issue.
They're supposed to restart full sanitation sweeping, I think July 5th.
Right.
July? Okay.
Yes, so though they're supposed to reinstate their full service again at that time.
Can I just add a point, if I
But
may?
I'll still say what,
Hello?
Victor?
Hi, Victor.
Yes.
Yeah.
Sean Abreu introduced 2 bills on Friday into the city council regarding rats, right? One was for buildings that have been cited for numerous rats. They would have to put their garbage out in rat-proof containers, right?
Oh, okay.
And then one is the same buildings would have to put their garbage out, I think, between 4 and 6 a.m. only on the day of collection. Right now, they put them out overnight. But my question to Sean, he hasn't responded yet, why don't all buildings, why they're not required to have rat-proof containers, they put,
Right, right.
they put these bags out at night. They tried
Right.
this scented thing, which worked for a while. The rats got used to it. And now they run in and eat everything from the bag. It's like a smorgasbord for the rats.
And also
So-
the restaurants. The restaurant, they put all that
Right.
food out in non-containers. And you,
Right.
you see all that, yeah, that's true.
So
No, it's true.
I had asked Yutha to bring it up at her cabinet meeting, but I might try and attend myself I want to find out why we got away from garbage cans or even the plastic containers. And my thought is it's a union thing. It's much easier for them the sanitation workers pick up a bag, throw it in the thing and keep moving. They don't have to put the can back on the sidewalk. But right now, because of the infestation we have, we need the rat-proof containers to be out there at night. I walk home from my garage some nights, and I walk in the middle of the street now. I don't even walk on the side.
So do I. I'm
Yeah,
I'm not
that's
afraid to
about
say it. I'm
And
scared.
some of the cars are having their wires, chewed by these
Yes.
rats.
Deidre on our board, she said she had her wires eaten up by rats, and her building on 148 is infested. She said rats are in the walls now.
Oh
in
God.
some of the places.
Oh my God. No,
That's crazy.
No, it's disgusting. It really is. It's outrageous. And like I said, I do the same thing, Victor. I walk in the street, and it's by the
Walk in the
grace of
street.
God, I haven't gotten hit by a car because I'm afraid of the rats coming out and running over my feet.
I've had them run across my feet more than once, and
Oh
I'm
Lord.
done.
See,
Yeah,
guys, if that happens to me, I won't be at the next meeting. I'll probably have a heart attack. I'm sorry.
No, it's not a good feeling.
No, it's not. Oh my God.
So it's something I'm going to take up with Sean again. Why can't all buildings in our district, let's start with our district, be mandated to have rat-proof containers to put the garbage out overnight?
Yeah,
We'll
Let me just ask, most buildings, do they get their containers from the city, Department of Sanitation? I know some cities they do, or
I don't think so.
will
I
do
don't think so.
private.
I would.
Well,
I
people
know in,
steal,
number
people
of cities
steal the
there.
cans. People steal the cans, and so that's
think-
problematic.
I think
Okay.
even to shorten the time that you give the rats an opportunity to have access to these, bags, what you see is that they take them out, sometimes 4 or 5 p.m. and it stays there the whole night. So what you're allowing is for these rats to basically feast, and they,
Exactly.
that is the problem.
Yeah, but that's the rule. You have to place it out between 4 and midnight.
That's
You
right.
have to, so
So
the
maybe
rules
they
have to
can
be
decrease
changed.
the time, and then in my neighborhood, they come around 1 or so. But you have a very long window, and I agree, between 4 and midnight.
Right. You said we
That's
had the
true.
one that's in 1 in the morning?
Around 1 in the morning, around my street is when they come to pick up the garbage
Wow.
at night.
And nowadays with technology, SDNY can map, these pickup where they can have a shorter window, and they let these buildings know on this day between this time and this time you can put your garbage out, and not just have over 12 hours where garbage is just sitting there.
Right.
Yeah.
Exactly. Yes.
I
And
like the
literally,
idea.
we
I
have
like-
to chain the cans down, or they will be stolen. It's a
Oh, so
shame.
that's what I was gonna ask you. The containers themselves, the cans are metal cans? Is that
Yeah,
what-
the rat proof kind that, I've gone to that rat academy, so I have several, but I won't even put them out because they'll be stolen.
Oh, man, really? I
Well,
didn't know.
can't they
people-
chain them? Can you chain them to your fence? And they
Yeah,
can-
I do chain them to my fence.
Right.
I had to start chaining them to the fence, or they're
And
stolen.
now you have to chain both the top and the bottom. Before it was,
Yes, because they will,
bottom, and it's
because
top
then they
and the
go
bottom.
into the cans, and then the top, is missing.
Yeah.
And during COVID, I had to tell people they have to take care of their own garbage. I can't be dealing with garbage. I'm afraid of the rats around
I don't blame
taking their garbage out. No. Mm-mm.
That's a good
Uh,
point.
yeah.
Yeah.
Well, I've taken notes. I'll reach out to Department of Health, to Pauline tomorrow. And I'll reach out to Department of Sanitation. I'll see if there's someone's name that Edwin, you had given me before, and I did write. I just thought for sure somebody, they were kind of quiet, but I thought they had come to a meeting. So I'll.
No, they didn't. We invited them, but they didn't show up.
Yeah, I'll look over that email again, and then I'll touch base with youth also to see if she would provide the contact.
There are rat-proof bags, bags that give off a smell that rats don't like. I don't know if, you know.
Doesn't work anymore.
Oh, they're used to that scent.
They don't work
Doesn't work.
anymore.
Oh, Pizza Rat has taken
They're
over.
used to that scent.
Yes.
Pizza Rat has taken over.
I used them when I was working at night too. We used them, and a year or two later, they laughed. The rats laughed at us. No, it doesn't work. You know, like anything else, they become accustomed to it. The mint, they were mint bags, had mint trace on them, but
Yes.
it doesn't work anymore. So save your money.
Now they're looking for the flavor bag. They're like, where are those bags?
Right.
It was a flavor bag.
It tastes better.
No, this is boring. Oh man, now you know it's time to go to bed.
All right. Well, we're not doing too badly. 9:39. So, but it was. I think there was no.
There was one more thing on the
new business
agenda.
would be the rats, huh?
There was one more thing on the agenda.
Oh, I know that Victor. I wasn't sure if we had provided enough information or if we got feedback. We need to have other representatives for strategic planning. Because I felt bad. I thought there was a meeting I could make, and I didn't, but we need a representative. Solomon, I thought he was on the health committee. He is not.
I
And
thought he was too.
I don't know, Edwin, can you make strategic planning now? Because I think you were interested in being
Yeah,
on strategic planning.
I'm going to.
You can rotate
Okay,
it.
now
as
you
well.
Yeah.
Yeah.
And what we agreed on.
Mm-hmm.
Yeah, what we agreed on was rotation. Yeah.
Yeah. As
Okay,
long as
so
person
who's the
brings
other?
information back.
The only problem with me is that it's on Thursday, right, Victor?
It's on Tuesdays.
It's on
Tuesdays.
Tuesday.
Okay. What I would
Tuesday of
say,
the month.
what I would say is, you know, we should have two people.
Yeah, that's what I'm trying to get there.
Because it's just a little unpredictable. You know, my scheduling with the hospital. Sometimes, you know, I have to stay late. So if we got two people, even if that person can make it or I can make it, at least we will have, you know, some coverage.
Okay, so who?
I've gone and I actually like going. I might be challenged though this Tuesday because I'm working the early voting. I was looking at my schedule, Victor. Because I told you I wanted to go. That might be the only thing I might be working to register people. So.
Okay.
So if if I'm not scheduled, then I'll definitely come. But I have to find out. It's not confirmed yet. But I'd be willing to go.
If you guys
Can we do
communicate-
early voting right now? I'm just that's a sidebar, but.
Yeah. If you guys can communicate amongst each other and see who's going to make it. Like I said, it's going to be, I think, an important meeting as far as our youth and what's going on, and who's going to be providing jobs and you know, other things, kind of all boiled into health. So just let me know. You know.
Okay, so Edwin is one. Well, Jenny, I don't know what Jenny's schedule is like. There's Heather, Monica.
Like I said, you can rotate it. I don't need to
Everybody's
know right
here.
now. Yeah.
Yes, I'm here. I'm here.
So we need, if you guys could think, there's a very strong subcommittee, ad hoc committee, strategic planning, and we need to be represented.
Okay.
That they meet on Tuesday. So we'll figure it out and you'll send something.
You can
we
rotate
need,
it. You know, whoever's available, whatever time that works. That works.
Okay, so we know Edwin, but we need a backup. And then any of us can attend. but we just need to make sure we have a sure representative.
Okay, I'll let you work
Okay,
that
okay.
out.
All right, so that's another bit of information to get out. And let's see. And then I guess we could discuss some of the other issues that strategic planning wants our feedback on as it relates to health and environment and the community benefits plan. So we, really gotta
Well,
be able to,
Columbia's
be
new
strong in that.
Director for Government Affairs will be at my meeting to answer a series of questions that I submitted last month, and she just started. So if you have questions that you might want that are related to the community benefits agreement, you send them to me. I can maybe get answers for, on my next meeting on the 21st.
Okay.
If not, we'll do it, the following time. So it's an ongoing thing with the benefits agreement. Just want to make sure health is covered. It's a large
Are you
section.
meeting during the summer, Victor?
I am not.
Okay.
Unless it's an emergency, I will try to relax and get away a couple of times.
Okay. Very good. Enjoy. All right. If there's not anything else, anything else to discuss, can we entertain a motion to adjourn?
Motion moved. Sorry, was I too quick?
Can I get a second? I know there's a second. Can we
I'll
get a
second.
second to adjourn?
I'll second.
Okay. And we'll just hang on for a second to make sure we have these minutes. Okay, everybody, thank you for attending, and have a great few weeks. We'll hopefully see you in July.
Yeah, thank you all.
Okay.
Thank you for the meeting, everybody.
Great.
Yes.
Great meeting.
Yes.
Great meeting. Thank you.
Thank you. Thank you.
Thank you.
Thank you
Okay.
all.
All right.
Laquita, I have created a minutes here.
Is that Jenny? Jenny, you're still on.
She needs some-
Jenny. Oh, there she goes. Okay, so you have the
Sorry.
minutes. So can you just email them to me like you did the last time?
Sure, I'll email them to
I mean,
you.
when I say the last time, January, and February is perfect. I don't know what, now I have recordings, but it's like I gotta go through. There's one time you did send notes, but the other time something happened and there were no notes, so
I mean,
anyway.
I sent it to you already.
Okay.
You